Can you hear me?
Can you introduce yourself and which session?
Hello? Hello? Do you hear me? Do you hear me?
We can hear you. Thank you.
Okay, thank you. Just to test my micro.
ที่นั้นเรื่องที่เราจะทำที่เกิดหัวค่ะจะเป็นการขยายพันธุ์ไม้ดอกและการดูแล
Good morning, dear delegates. May I kindly ask you to take your places, please, so that we can start. Your seats, please. Thank you.
Good morning, everyone. Namaste, and welcome to the 2025 thematic discussions of the Commission on Narcotic Drugs. As you are aware, we will discuss the implementation of all international drug policy commitments and especially follow up to the 2019 Ministerial Declaration. Before we start, I wish to invite the meeting to adopt the provisional agenda, which has been shared together with the invitation to these thematic discussions. I hope you've seen the agenda. Are there any comments? I see no comments. The agenda is accordingly adopted. Thank you very much. Before we move to the substantive part of the program, I wish to give the floor to Ms. Yodeden Aman, Secretary to the governing bodies, for some announcements.
Thank you. Thank you very much, Mr. Chair. And my message is addressed at the online participants to please indicate in the chat if you want to take the floor. Kindly do not use the raise the hand button, but once the chair gives you the floor, you can turn on your mic and your camera. And kindly also indicate the name of the country or the organization that you represent. Thank you very much for your cooperation.
Excellencies, distinguished experts, esteemed colleagues and delegates, today we start the 2025 CND intersessional thematic discussions on implementing all international drug policy commitments, building on the 2019 Ministerial Declaration. A very warm welcome to all of you and also to those joining us online. In March 2024, the Commission adopted the high-level declaration on the 2024 midterm review. The declaration recalled existing challenges identified in 2019 and mentioned intensified challenges such as those related to synthetic drugs, access to and availability of essential medicines, the misuse of technologies for drug trafficking, and violence linked to drug trafficking networks. The declaration also identified quote-unquote new challenges, including the impact of drug markets on the environment, misperceptions of drug-related risks, and addressing harms associated with illicit drug use. In the way forward section of the declaration, the Commission emphasized 4 key cross-cutting issues that serve as a lens for addressing the global drug problem: cooperation at all levels, data collection and analysis, technological innovation, and capacity building and resource mobilization. These 4 issues will be a common theme throughout the thematic discussions leading up to 2029. The Commission has been holding these discussions annually since 2019, each time focusing on challenges identified in the Ministerial Declaration. These challenges address a wide range of issues that constitute what you would agree is the complex world drug problem. This year, we will continue the implementation of the work plan for the CND thematic discussions 2024 to 2028, which was adopted by the Commission in May 2024. As per the organizational arrangements adopted by the Commission based on the work plan adopted in 2024, discussions over the next 3 days will cover the following topics. Day 1 morning, that's today, the topic of prevention as a core element of the public health response to drug use. This afternoon, the topic of drug treatment and health services falling short of meeting needs, increase in deaths related to drug use. Tomorrow morning, the topic of high rates of transmission of HIV, hepatitis C virus, and other blood-borne diseases associated with drug use. Tomorrow afternoon, we will take up the topic of adverse health consequences and risks associated with new psychoactive substances. On the third day in the morning, we will take up adverse health consequences of and risks associated with new psychoactive substances. And in the afternoon, we shall discuss other substantive matters. Dear colleagues, following the adoption of the 2024 high-level declaration and in line with the commitments made in the 2019 Ministerial Declaration, we seek to foster broad, transparent, and inclusive discussions. The hybrid format of our thematic discussions provides greater flexibility and enables experts and relevant stakeholders from around the world to participate in the Commission's work. I'm very much looking forward to a fruitful exchange this year, focusing on sharing updates and key lessons learned in addressing the aforementioned issues. I have the honor of initiating the 2025 CND thematic discussions with opening interventions by my esteemed colleagues. And I have the pleasure to welcome, to start, Ms. Gaurav Vali, Executive Director of the UNODC. Madam, you have the floor.
Thank you, Ambassador. Good morning, everyone. Mr. Chair, Excellencies, ladies and gentlemen, I'm pleased to address you at this important intersessional meeting of the CND. Today's meeting comes at a critical time for international drug policy and the UN as a whole. Just a few days ago, I returned from New York, where member states and the Secretary General are leading the UNAT reform process. These reforms are suggested to make the United Nations fit for purpose in the face of fast-moving global challenges. And as we speak of global challenges, we must keep drug control firmly on the international agenda. Today's meeting gives us an opportunity to follow up on last year's midterm review of the 2019 Ministerial Declaration and to chart a path forward together. Because the world drug problem is growing and is becoming more sophisticated, more unpredictable, and more harmful. The 2025 UNODC World Drug Report shows that drug use prevalence is up 16% compared to a decade ago, with more people consuming multiple drugs at the same time, often using unknown and dangerous and sometimes lethal combinations. It shows a drug market that is rapidly evolving, with organized criminal networks moving record shipments across borders, exploiting new markets, and generating billions of dollars in illicit profits every year. And it shows that too many people still lack access to treatment. Globally, nearly a quarter of all people who use drugs suffer from drug use disorders, but only 1 in 11 receives the care they need. For women, the treatment gap is even wider, compounded by stigma and discrimination, especially in the global south. Young people remain particularly vulnerable to new psychoactive substances, often marketed online or packed to attract. And 87% of the world population still lacks access to controlled medicines for essential palliative care and pain relief. Meanwhile, health risks are greatly amplified by unsafe drug injection, including risks of HIV and hepatitis C, especially among vulnerable groups, such as people in prisons. Together, these factors place a serious strain on public health systems that are already stretched too thin. Amid these sprawling challenges, the resources being invested in the global response are shrinking. With fewer resources, we lose the ability to anticipate and respond to new threats. We lose the technical expertise to analyze and safely handle dangerous substances. And we lose the capacity to provide the treatment that can mean the difference between a life saved and a fatal drug overdose. When investments fall, the costs multiply. More people harmed by drugs, more profits for traffickers, and weaker capacities to respond. Excellencies, if we are to meet these challenges, our responses must be guided by science, grounded in evidence, and supported by international action with adequate investments made available. Last year, I was proud to launch our CHAMPS initiative, using science to amplify effective drug prevention systems. I'm pleased that 10 countries have already committed to building prevention systems for youth resilience. And just yesterday, I had the honor of welcoming Her Majesty, the Queen of Belgium, to the DIC, herself a strong advocate of drug prevention and of the SDGs. This year's CND resolution on promoting prevention systems for children and adolescents is another important step, and commitments must be followed by concrete action. We also need to keep building scientific expertise and technical capacity. Laboratory analysis underpins much of our work in shaping effective drug responses, from ensuring reliable data to exchanging information and providing early warning on new substances. In 2024 alone, the UNODC Early Warning Advisory identified a record number of new psychoactive substances in a single year. That is why I encourage member states to continue strengthening their national early warning systems and sharing information with UNODC. The stronger our tracking systems, the faster and more effectively we can respond. At the same time, we must expand our work on research and treatment, particularly for stimulant use disorders. To address this challenge, UNODC, together with WHO and the EU Drug Agency, launched the Scale Up initiative in 2024. At this year's CND, member states built on that work by adopting a resolution to promote research into stimulant treatment, and follow-up will now be essential to translate the resolution's commitments into concrete actions. We must also strengthen our partnerships, especially with the private sector and tech companies. And I also had the privilege to meet with Meta, X, and Snap while in New York to discuss prevention and the Prevent Alliance that was recently launched. Drug markets are increasingly moving online, where we must focus more of our attention, be it to bring down sites that promote drugs or to use the social media where millions of youth are connected to promote and develop content that is raising awareness and encouraging youth to avoid doing drugs. Drug markets are increasingly moving online. I said that, where we must focus more of our attention. Such collaboration will be essential going forward to protect young people from dangerous substances circulating on digital platforms. Lastly, none of our efforts will succeed without renewed financial and political commitment. Member states must demonstrate solidarity in reducing health-related suffering. Without sustainable funding and political will, we cannot meet the growing scale and complexity of the world drug problem. Ladies and gentlemen, the 2019 Ministerial Declaration and its follow-up frameworks are pivotal for ensuring that international drug policy remains adaptive, evidence-based, and aligned with the mandates of the United Nations. UNODC stands ready to assist member states with data collection and analysis, technical assistance, and capacity building. But we cannot do it alone. We count on your engagement through your contributions, progress reports, and high-level participation at the CND. Together, we can deliver on the promises of the 2019 Declaration and move closer to a safer, healthier world for all. Thank you.
Thank you, Ms. Wali, for that statement. I now invite everyone to watch a video message from His Excellency Lok Bahadur Thapa, President of the Economic and Social Council.
Excellencies, dear colleagues, I'm pleased to join this year's CND thematic discussions on the implementation of international drug policy commitments, and I thank you for the kind invitations. The focus this year on promoting health is central to the 2030 agenda. At the 2025 High-Level Political Forum, SDG 3 on good health and well-being was under in-depth review. That review benefited greatly from the contributions of the CND on the vital links between drugs and health. The review was sobering. Preventive health gaps left by the pandemic remain unfilled. Debt is crowding out investment in health and education, and treatment for substance use disorders has fallen from 11% to 9%, leaving millions without care. The 2025 World Drug Report adds to this troubling picture. Drug-related deaths are steadily rising. More people are living with drug use disorders, and major gaps persist in access to treatment and care services and controlled medicines for palliative care and pain relief. These findings reminds us of the urgency to act, to strengthen prevention, especially for young people, to expand access to treatment and care, and to respond to new and emerging health challenges. Drugs and health policies must move together across sectors and with the voices of women, youth, and communities at the center. Excellencies, dear colleagues, your discussions today can have real impact, transforming lives, restoring communities, and turning vulnerabilities into resilience. But to succeed, efforts must be inclusive, engaging all stakeholders across all sectors and at all levels. The Commission's role as a subsidiary body of ECOSOC is vital. I take this opportunity to reaffirm our shared commitment to advancing international drug policy commitments as part of the 2030 agenda. Looking ahead, I encourage CND to channel the outcome of these thematic discussions into its report to ECOSOC so they can inform the Council work and contribute to future follow-up and review of the 2030 agenda. At a time when confidence in multilateralism is under strain, this is the space to build bridges, share solutions, and scale up actions. Let us work together to make drug policies deliver tangible health and development gains and build a safer and healthier world for current and future generations. I thank you and look forward to the outcomes of your discussion.
I thank His Excellency Thapa, and as you would be aware, I was also in New York in June to present our outcomes of the CND regular session at the high-level political forum, and I do welcome the close engagement between ECOSOC and the CND. I now wish to hand over the floor to the President of the International Narcotics Control Board, Professor Atasoy. Ms. Atasoy, you have the floor.
Thank you. Mr. Chair, Madam Boali, Excellencies, ladies and gentlemen. It's an honor to represent the International Narcotics Control Board at the opening of the 2025 thematic discussions of the Commission of Narcotic Drugs. The board looks forward to engaging with the Commission and Member States in the days ahead to advance the implementation of the 3 international drug control conventions and to ensure the effective functioning of the international drug control system for illicit trade in controlled substances. Our shared objective remains clear: to safeguard health and welfare globally. Allow me to briefly highlight several cross-cutting issues that will be addressed during these discussions, namely cooperation, data collection and analysis, technological innovation, capacity building, and resource mobilization. The board is collaborating closely with member states to address true critical drug control challenges, both of which demand continued international cooperation. First, through the INCB precursor control and GRIDS programs, we are supporting governments in responding to the serious public health threat posed by the rapid proliferation of synthetic drugs. INCB is actively preventing and reducing the illicit manufacture of drugs through technological innovation and enhanced monitoring systems. Last year, the board assessed 2 fentanyl precursors and 16 precursors of amphetamine-type stimulants, recommending their international control. We monitored nearly 28,000 shipments comprising 32,000 tons and 5 billion liters of controlled precursor chemicals through the PEN online system. Additionally, over 700 shipments of more than 136,000 tons and 3 million liters of non-controlled precursor chemicals were tracked through PEN Online Lite. Use of PICS system helped prevent the diversion of 2,600 tons and 500,000 liters of precursor chemicals. Notably, international cooperation facilitated by the INCB Pen Online platform recently thwarted an attempt to divert 3 tons of fentanyl precursor, 1 box for piperidine, enough to produce an estimated 1.4 to 3.3 tons of fentanyl. Under the INCB GRIDS program, nearly 25,000 incidents involving 850 unique new psychoactive substances across 160 countries were processed through the IONIX system, bringing the total number of recorded events to over 100,000 in 2024. Operations such as Zodiac and African Star led to significant seizures and interceptions of illicitly manufactured pharmaceuticals. GRIDS also issued operational alerts to help governments counter the diversion and misuse of veterinary pharmaceuticals and conducted 45 events for 1,300 officials to coordinate operational responses through GRIDS regional technical officers based in Almaty, Bangkok, Cairo, Lagos, Mexico City, and New Delhi. Second, turning to the illicit requirements for controlled substances, INCB data continues to reveal persistent disparities in the availability of narcotic drugs and psychotropic substances for medical purposes. At the same time, our data and analysis indicate that the global supply of opioid raw materials exceeds reported demand. This discrepancy may stem from inaccurate estimates of medical needs submitted by some countries. To address this, INCB Learning trained by the end of 2024 1,462 officials from 154 countries through e-learning modules and virtual and in-person training. In 2025, INCB Learning training has been held for countries in the Horn of Africa and West Africa. To ensure adequate supply for medical and scientific use, in 2024, INCB processed over 8,500 estimates and assessments for more than 4,000 tons of narcotic drugs and psychotropic substances used in anesthesia, pain management, opioid agonist therapy, and the treatment of neurological and mental health conditions. These achievements, made possible through collaboration with member states, are a testament to multilateralism in action and the tangible translation of treaty provisions for the benefit of humankind. However, our efforts are increasingly constrained by resource limitations. The liquidity crisis affecting the United Nations regular budget is impacting INCB's operations. Postponement of INCB country missions hinders our ability to support treaty implementation. Online-only meetings, such as the 142nd INCB session in February, limit the board's capacity to deliberate and process critical estimates and assessments. Also, without stable extra budgetary resources, the impactful work of the precursor control, that being part of the board's mandate under the 1988 Convention, should be funded by regular budget resources, and GRIDS programs and INCB's digital transformation initiative, Next Generation IDS, will cease. Thousands of shipments of precursor chemicals will go unmonitored. Reviews of chemicals for possible international control will be delayed. Incidents involving hundreds of dangerous substances will remain unprocessed. Operations will be suspended, increasing the risk to public health. The issuance of operational alerts will stop, depriving national authorities of vital intelligence needed to interrupt trafficking in potent synthetic opioids and veterinary pharmaceuticals. INCB remains firmly committed to supporting the Commission and Member States in fulfilling their treaty obligations and achieving the shared goal of protecting health and welfare. But to do so, we must be entrusted with sufficient resources. Thank you.
I thank Professor Atasoy for her intervention and invite now the video message of the Assistant Director General of WHO, Dr. Yukiko Nakatani, please.
Excellencies, distinguished delegates of the Commission, dear colleagues and friends, WHO welcomes this year's thematic intersessional focus on the health aspects of drug use. Harm due to non-medical drug use is a pressing public health challenge. It places a profound burden on individuals and communities, from deaths due to overdose to infectious diseases such as hepatitis C, to drug dependence and other mental health conditions. It drives wider negative social consequences. New harmful psychoactive substances are appearing on the illicit market every day. We also see increasing detections of falsified medicines that contain deadly drug combinations and are used for non-medical purposes. It is essential that we widen access to prevention and treatment. This requires stronger global actions, especially since safe, affordable access to life-saving medications, including those that are internationally controlled, remains limited in many parts of the world. A truly effective response to drug use must be rooted in public health, with active leadership and engagement of ministries of health at all levels. Their involvement ensures that prevention of drug use, treatment of drug use disorders, harm reduction, and access to controlled medicines are integrated in national policies supported by the whole of government. WHO strongly encourages the empowerment of the health authorities to shape drug policies that prioritize health, well-being, equity, and human rights. We also call for stronger collaboration across health, justice, education, and social sectors to build resilient systems that address drug-related harm in a coordinated way. Let us reaffirm our commitment to a balanced health-centered approach with ministries of health at the forefront of national and global efforts. I thank you.
Well, I think that concludes our high-level speakers. I have the pleasure to thank Ms. Wali, His Excellency Thapa, Professor Atasoy, and Dr. Nakatani for their insightful statements. And I think these have set the stage for our discussions over the next few days. We will now take a 1-minute admin break so the podium can be rearranged. I would also invite the panelists and the moderator for the first session to join us on the podium. All of you, please remain seated. Thank you. Okay, I think in the interest of time, may I ask everyone to settle down, please? Start the next session, and we will continue with our session rather.
Angela.
Angela is sitting on the next to the podium.
Okay.
Okay. We seem to have our seating in order now. Excellencies, distinguished experts, esteemed colleagues, and delegates. Before we begin the discussion, let me address some administrative points. Firstly, regarding the format, we will start each morning with what we call an evidence snapshot. It will be done by the UNODC research branch on the topics of the day. And then each thematic session will start with an introductory presentation or presentations from our colleagues at UNODC, which will be followed by an expert panel discussion focused on the lessons learned. And thereafter, the sessions will be divided into morning and afternoon segments. The morning session will be from 10 a.m. to 1 p.m. and the afternoon session from 3 to 6 p.m. Vienna time. There will be no list of speakers. Those wishing to make interventions and ask questions during the open discussion, which I encourage all of you to do, can do so by raising their delegation's nameplate if they are in the room, or by indicating it in the meeting chat if they are connected online. I will select speakers based on the flow of the discussion and the time available. Please try and limit your remarks to 3 minutes to allow as many interventions as possible. The outcome of the thematic discussions will, in line with past practice, take the form of a non-negotiable chair summary, which will be brought to the attention of the CND in the form of a conference room paper at its 69th regular session in March 2026. Without further ado, let me welcome Ms. Angela May, Chief of the Research and Trend Analysis Branch of UNODC, to provide us with an evidence snapshot for the first two topics that we're discussing: drug use prevention and drug use treatment. All of you know Ms. May, who is one of our foremost experts. And Ms. May, you have the floor.
Thank you. It was nice to actually hear many at the beginning to speak about the World Drug Report as of evidence. So it's nice to have, a shared evidence that can start your discussion. Before coming here, I was in a meeting with colleagues from the UN system, and I was saying, I need to rush because I need to go to the Commission on Narcotic Drugs. And I said, this is something unique that we have in Vienna that I don't think they have in other UN fora. That is, we always start by first presenting the evidence. And so I think it's a treasure that I hope, to be kept as really a great tradition. So let me start by, tell you, so what does the World Drug Report says about what you are discussing these 2 days? And one point is to understand how big is the problem you are discussing. And with all the challenges we have on putting up the data, one thing we can clearly say is that the problem is increasing, is becoming bigger. And here you see the number of people who use drugs and the prevalence with the dots of those that use drugs. And you see that both are increasing. And, in terms of number, in 10 years, almost 30% more. In terms of prevalence, so the actual rate of use, 15% more. And then 13% more on people with drug use disorders. So that's, again, we can discuss on, these numbers may be plus and minus 1 or 2, etc. And you see the bar on the uncertainty level. But we can really clearly see that is increasing. And this is reflect also not only an increasing, why do we care? Why do we care on the number of people who use drugs? And because drug use is harmful. And I'll give some a snapshot on the harmfulness of drugs. But here it gives the idea of, again, how big is the problem and how different is the problem. Without going into the details, the different colors that you see there is the different drugs. And so different size, it means the magnitude of people who use drugs for the different type of drugs. And then what it says is that it's different for different countries, for different regions. If it's a common challenge, I think it's important to understand also that different dynamics also affect different geographical location. And what I wanted to emphasize here is that what we are seeing is an increase in the use of what I would call traditional drugs. Drugs could be plant-based, synthetic drugs, but they have established good large markets. They act as they are internationally controlled. They have been internationally controlled for many years. But what we are seeing is also the increase of the non-medical use of pharmaceuticals. And this is a different policy concern because we are talking about substances, most of them are not under international control. We are talking about tramadol, ketamine, and now seeing a very fast increase in pregabalin. So, and I think, again, it's important to understand because it's a kind of a bit of a different policy. In a context where, as was mentioned also by Ms. Wali and the president of INCB, that where there are contexts where there are not enough pharmaceuticals to treat pain and to treat patients, we have actually a context where the non-medical use and the trafficking of those pharmaceuticals are increasing. Now, I said, why do we care? Because drug use is harmful, and it's harmful particularly to the health, not only. And here, just in terms of numbers, 14 million of people who inject drugs, and I would say almost 7 million that live with hepatitis C, and 1.7 that live with HIV. And I think it is interesting to see the graph on the right, is because where is harmful? What is that make drug use particularly harmful. And here is important to see the color. And the light green color that you see, the big bar, is relating basically to the hepatitis C and to infectious diseases. So what makes, and these are the number of deaths. So again, the problem is increasing, the harm is increasing, but what makes people most dying of drugs is actually, the infection diseases that drug use trigger. And the dark green there is basically the drug use disorders, so basically overdoses. And again, it's important to understand that what we have documented this year in the World Drug Report is this harm and how it works, what kind of harm. And here you can say, and again, there is plenty of scientific literature that describe the harm to health in terms of medical and psychiatric comorbidities, the long-term impact on health, the mortality. But what is interesting, I think, that we have documented is that this harm is preventable. And it's preventable because you see here from drug use and the impact. So preventable at the beginning to prevent drug use from the start. And you will discuss prevention all of these days. So that is the first preventive measure to reduce that drug use. Then not everybody that use drugs, that initiate drug use, end up with drug use disorders. Actually, the percentage is not very big. Depends on the drugs, but again, another preventive measure is to ensure that those that start drug use, they don't end up with drug use dependence. But then once it ends up with drug use dependence, there are a lot of elements that determine how that can be harmful. Some of these elements are depending on the person. They cannot be changed, the sex, the age. But some of what we call here modifiers are preventable, and then really depends on the responses that you are discussing these 2 days. And services provision, treatment, measure that minimize the social and the health consequences of drug use. That can prevent the bars that I showed you earlier in terms of deaths. So now, what is the response globally? How can we assess? We understand the challenge. I want just to show here, I know that is not the topic of your discussion, but to make a point here that very often also drug use has a criminal justice response, probably more than the health response that deserve. And here is the estimated number of people that are arrested, prosecuted and convicted globally. And you see the different, the blue that you see is the number of people that come to the attention that are arrested for drug use or possession offenses. So you see that the criminal justice globally, of course, this is an average, it's not everywhere, it's a global average that is focused more on the most vulnerable. But while, as it was mentioned earlier, the health response remain very limited. And here is the percentage of people that are in treatment, the percentage of people with drug use disorder that are in treatment. And you see the different colors, the different regions. In some regions, more than in others, particularly you see Africa, but also for women. 1 out of 18 women that needs treatment is in treatment compared to 1 out of 7. So that, I'm sorry, I know that I went beyond the 5 minutes. Thank you.
We're going to forgive you this time. Before we start the discussion, I've been informed by my colleagues at the Secretariat that, Ms. May, this is your last working day at the UNODC. I would like to extend a heartfelt thank you on behalf of everyone here for your inspiring leadership, for your passion and commitment, and for taking UNODC's research work to new heights. We wish you all the best in the next chapter. You state all those hard-hitting facts with a disarming smile. I would now like to give the floor to Ms. Yode Deneman for some remarks.
Thank you very much, Mr. Chair. Dear Angela, and I'm going to use the words of Doris on behalf of the entire team of the Secretariat to the governing bodies, because I think they are really bringing it to the point. For years, you have been the voice of evidence and the heart of research in the Commission on Narcotic Drugs and the Commission on Crime Prevention and Criminal Justice. The data are clear. Your impact was immeasurable. Your presentations unforgettable, and your legacy statistical significant. We wish you every success and happiness in the future. A big, big thank you.
Okay, now I would like to welcome Mr. Wadi Malouf of the UN ODC Prevention, Treatment and Rehabilitation section, who will be introducing and moderating the first section. First session on drug use prevention and supporting me throughout the morning session. Mr. Malouf.
Thank you very much, Mr. Chair. With that being said, I just would like to welcome everybody again and thank all the colleagues and friends around the table and in the room joining us online and all following this through UN Web TV. So in the beginning, given to place that session into context, I would like to kind of segment probably what I'm going to say into three sections, good news, bad news, and probably a plea at the end. I will start with the good news. UNODC sustained support for and commitment in terms of prevention over the last 15 years is finally paying off. The science of prevention is being recognized, not only in theory, but in practice as well. We see that evolving language coming more and more into fruition within the CND resolutions. Prevention is now prioritized. And I guess our meeting in terms of a first session with regard to this effect is a testament in this matter. We see development of new tools for policymakers, for service providers put in place. The international standards are at your disposal. The review of the prevention system as a new tool. These are open source materials that are added to our life, family skills, and youth-based programs that are being more and more recognized and mentioned as evidence-based tool when we say we want to articulate prevention. Member states have pledged investment in prevention in 2024 during the high-level meeting. The UNODC World Drug Campaign have echoed this message loud and clear by saying the evidence is clear, invest in prevention. This session again is mentioning the fact that it's no longer peripheral, it's a central topic. The political will is definitely here. There's a growing understanding on what prevention is, that if done right, it goes far beyond just reducing drug use. The standards approach focus on supporting individuals through their environmental context and their developmental milestones, tailoring all the support they need. And by addressing this, my colleague Angela mentioned the fact that these mediators, these modifiers that are working are not only linked to drug use, but they are linked to, they can curb violence, they can curb criminality, they can curb improve mental health, they can boost education, they can strengthen communities. So that investment is larger than preventing drug use by itself. From the launch of the standards, a major milestone that we would highlight is the launch of the CHAMPS initiative, the Children Amplified Prevention Service that our executive director just mentioned. It's a flagship initiative that puts all the tools that I mentioned and all that political will into action, supporting children and adolescents. Member states have shown strong commitment and several pilot supporters are in place. And probably I have a 40-second clip that would probably do better justice than describing this CHAMPS initiative. If I can have that clip just launched for 40 seconds, with your permission, Mr. Chair. Thank you very much. So this is just a snapshot in terms of what it is, and we invite more member states to join. And from this, I move to the second part of what I'm going to say, which is let's call it the not so good news. Despite all this progress that I mentioned, we witnessed a short-lived period of increased investment in prevention, but nowadays this investment is receding. Despite the fact that today's generation is facing unprecedented challenges that you all are witnessing, from political instability to climate change disruption to rapid technological changes, these forces are reshaping norms and behaviors in the new generation in ways that impact not only drug use, but their vulnerability to use drugs. But in the scope of technology, also to open a bracket of a silver lining that our executive director also mentioned, that despite the kind of challenges of the technology advancement and then shaping norms, we applaud the formation of the Prevent Alliance and the public-private partnership in terms of the tech companies coming in and trying to mitigate drug-related harms through that social platform to think how we can move it forward. It's a promising step, and we hope it will grow and expand. But overall, funding remains fragmented, insufficient, and by far not matching the imminent needs that we discussed. Despite the fact there is the political will, there are the tools, the strategies to meet these challenges, not only to drug use, but as I said, for a broader health and welfare response. So I will end with a plea. Invest in prevention. The evidence is clear. The time is now. There's no need to retreat, but to act. We all have all the ingredients to make it happen. We have the momentum, all the momentum put in place. We can revise the standards, update them to with the new updated science. We will advance this CHAMPS initiative to showcase that investment in ecological way and a systematic way can change the prevention generations coming up in terms of children and adolescents. We need to arm more schools, more families, including those that are living in crisis situation or in humanitarian situations with the skills for effective prevention. And we can demonstrate again and again that there's a very high return on investment with that prevention can deliver, especially when it comes to children and adolescents in diverse contexts. So with that being said, I'm honored to welcome a panel of experts joining us to address key questions along the thematic of prevention as a core component of public health response to drug use. Let me take the time to welcome, first of all, we have Professor Francis Grace Ducapante, who's the director of the ASEAN Training Center for Prevention Drug Education and an assistant professor at the University of Philippines, joining us in person. We have Mr. Athanasios Theokaris, the National Coordinator for Addictions and President of the National Organization for Prevention and Addiction Treatment from Greece, also joining us in person. We have joining us online very early in the morning, I must say, the Chief of the Narcotic National Service for Prevention and Rehabilitation Program Division, SENDA, from Chile, joining us online. We have Ms. Marika Ferri, who's the head of the Health and Social Response Sector, joining us from Lisbon, Portugal, EUDA, joining us online. And we have Ms. Margaret Lilia Goodman-Stotir from the Vienna NGO Committee on Drugs, joining us also online. I would like to acknowledge the fact that Dr. Amin Bout, a psychiatrist from the University of Hospital Center of Fez in Morocco, could not unfortunately join us through unforeseen circumstances, but I welcome the rest of the panel. And we have a few questions to address to this panel that hopefully within a span of 3 to 4 minutes per question could further highlight the context of the thematic that we have mentioned. So with that being said, if I can pass the floor first to Professor Francis Grace, how can we introduce the science of prevention to policymakers and to help them better shape their prevention response and improve the quality of their prevention services from your experience?
Excellencies, Fellow prevention professionals and advocates, good morning. I will be talking from my experience as the director of the Asian Training Center for Preventive Drug Education. It is an office based in the Philippines and funded by the Dangerous Drugs Board. And we work alongside 10 member countries: Brunei Darussalam, Cambodia, Indonesia, Lao PDR, Malaysia, Myanmar, Philippines, Thailand, Singapore, Vietnam, and now we have an additional member state, Timor-Leste. Prevention science, with its multidisciplinary nature, scientific tools, and very strong grounding on both research and practice, has a tremendous power to transform mindsets of our policymakers. And based on experience, when our policymakers understand the value of prevention science, they become prevention champions. For example, they act. So ACT, I'm going to use it as an acronym. A stands for amplification. They amplify the prevention message by ensuring that these principles that are evidence-based are integrated into existing mechanisms and frameworks. For example, the ASEAN Work Plan on Securing Communities Against Illicit Drugs 2016 to 2025 was strongly grounded on evidence-based practices. Also in the Philippines, because of our dissemination of the Universal Prevention Curriculum for Substance Use, we have seen a shift from punitive approach now to a more health-centered approach. In fact, the Philippine Anti-Illegal Drug Strategy 2.0 has 3 strands now. So in addition to drug demand reduction, drug supply reduction, we also included health developmental services to ensure that we are giving compassionate care to people who use drugs. And we have a continuum of care targeting the different populations. So we have universal, selective, and indicated programs. So A is to amplify the voice of prevention. C is to cultivate a global culture of care. And this is through a whole of society approach. So we are tapping the stakeholders, public-private partnership, for example, and using faith-based organizations, because in the context of Southeast Asia, faith can be a very strong force in prevention. And T stands for translating prevention into interventions that are truly relevant and culture sensitive, because we know that good intentions are not enough. We need to do it the evidence-based way. Otherwise, we may be doing more harm than good. Thank you.
Thank you very much, Professor Grace. And I think this element of the amplifying, cultivating, and translating that knowledge is key, and relying on tools to kind of make that science heard by policymakers is a key ingredient to reshape the way they're thinking about prevention. And I guess it's a cornerstone that you have hinted to that change the perspective of the response beyond just prevention in terms of moving it to a health-centered way before it actually articulate in terms of use. So with that, I pass the floor to Mr. Theokaris. And the question will be moving from an academic perspective to a policymaker's perspective. What would policymakers need in terms of help to advocate and improve or maybe increase their investment in their investment potential in drug prevention, particularly when there are potential challenges in terms of advocating for a balanced approach and to ensure there is a comprehensive spectrum in place? What could policymakers account for?
Thank you very much. Good morning to all of you. Policymakers need 3 things, 3 main tools in order to advocate for prevention. Firstly, the evidence-based framework. Secondly, the institutional capacity and expanding access, as well as data and monitoring. And let me explain. On evidence-based framework, we talk about professionalism. On prevention, we talk about things that are measurable. In Greece, for example, we have 75 prevention centers, and they now apply the European curriculum, prevention curriculum, and also the 33 European drug prevention quality standards. This gives policymakers something that is credible, internationally recognizable, and this is a foundation in order to justify this investment that we do. Concerning the institutional capacity and the expanding access, with the establishment of the new organization that we have merged all the therapeutic organization in Greece, there is no longer fragmented the prevention scheme, and now we have embedded into one single entity and one single strategy. This means that it is easier for the government in order to advocate for sustainable funding from EU or from other schemes. Moreover, this provides all services across all the geographical areas, enhancing access for all and leaving no one behind. And lastly, data and monitoring. This is very crucial. Prevention must show results. This is the point that we have to advocate. Recently, we have launched national digital monitoring of all the prevention system, and we can monitor the scientific as well as the operational, let's say, work of all prevention centers and structures in Greece. So transparency and measurable outcomes strengthen political argument for investment. But the challenges still remain, as you said, Wadi, and this is the increasing appearance of synthetic opioids. This is the polydrug use that people and mostly youngsters face. This is also that an issue that we have to deal with. Prevention is to serve to secure sustainable funding. This is also very, very crucial because the outcome and the benefits of prevention are not seen before, after many, many years. And politicians always need to see very often very near to their future, to their political future outcomes. But funding is underrated. So prevention is not just a need, it's a necessity. And the necessity is combined with all the needs of the vulnerable people that we have to do. And especially some groups of people like Romas, like migrants, like women, like other people that are in need. And so all these policymakers, if they have them, they can judge and have a more clear judgment on investing on prevention. And as a new member of CHAMS, I would say to you all that you should invest on this initiative that UNODC comes and give us with evidence-based, with scientific methodology, and it's crucial for us, for the level we work, for the countryside, for every aspect that we have to do with prevention. Thank you very much.
Thank you very much, Mr. Theokaris. I mean, of course, you know, the policy framework and that are availed are key in terms of policymakers to understand that there is a science behind it, as you mentioned, and it's a modality also to bring the different silos together, because there's no one entity that can deal with the response. But indeed, data remains key because policymakers always are, you know, when we're addressing a problem, you see the problem in front of you and you're reacting to the problem, but we're preventing a problem that is not there, is a different level of data investment. And I guess these initiatives, like the CHAMPS initiative that you mentioned, in terms of showcasing development at a larger scale, not only with regard to drug use, is a further advocacy to help policymakers invest, and as you said, invest in a sustainable way rather than just on a piecemeal process. Excellent points. And I guess also in the meantime, we have regained access to joining our panelists that are online. And with that, I move to Chile, and Ms. Francisca Oblitlas is with us. And Francisca, if we really, the question for you is, in light with the decrease in the funding when it comes to human development projects in general globally, including health-related response, how can countries, including low and middle income ones, keep a momentum with respect to health responses nationally? And given that, you know, you're sitting in for Chile, could systems be one solution for this move forward? I really hope you could hear the question and you can react to that, Ms. Oblitas. Okay. Looks we have a bit of a internet connection issue. We'll give it a couple of seconds, and if not, maybe we can move to Portugal, to Lisbon in the meantime, and we return to Chile. Maybe we have better luck with Ms. Marika Ferri from EUDA. Marika, regarding the on your side, how could drug use prevention efforts carry a positive effect in addressing not only drug use but crime, violence, organized crime challenges, and probably potentially including prevention of recruitment of children and youth through these criminal organizations?
Thank you for the question, Vadi. I hope you can hear me well.
We can.
Prevention is a form of socialization, and as such can help individuals and the society they live in to develop their full potential for constructive contribution. From the perspective of health and social responses, acquisitive and associative crimes related to the drugs use should not be regarded solely as a matter of criminal justice system, but also as indicator of underlying social and health vulnerabilities. Prevention is understood, especially in the European context, as a broad and multidimensional approach, delivering a range of outcomes from providing meaningful alternatives and promoting healthy lifestyles to fostering social cohesion and building communities resilient to disruptive phenomena such as crime and organized crime. Evidence consistently shows that the most effective and sustainable approaches are those based on a whole of society perspective, which actively engages all relevant actors in their respective roles. This includes educators in school, managers of sports and cultural facilities, law enforcement and security professionals, as well as social and health services. Through multi-sectorial collaboration, such approaches create protective environment and expand opportunities for reducing the needs to rely on substance use and on illegal activities to finance this use. These principles apply equally to physical and virtual communities, where strengthening social capital and reinforcing protective factors are essential to reducing vulnerability and preventing behaviors that might otherwise lead to involvement on crime.
Thank you very much, Marika, for a very comprehensive view. Indeed, it is like, you know, a process of promoting healthy lifestyles, and it goes into broad context in terms of a whole society approach. And such a need is really building social capital. That's what we're looking for. And by that, in terms of return, of course, not only the drug use challenges are addressed, but a larger sort of community challenges that are interlinked are there. So with that being mentioned, maybe I should try and attempt to go back to Chile, you know, and I will readdress the question just in case, Francisca, you did not hear the question. The question addressed to you is, in light of the decreased funding for human development projects globally, including the health-related responses, how can countries, including low and middle income ones, keep the momentum with respect to health responses nationally? And as I said, given Chile's role in the previous resolution on systems, could systems be a way through? The floor is yours. Ms. Sobritas.
Hello, can you hear me well?
We can hear you well.
Okay, thank you. We had kind of little technical problems. I'm so sorry. Well, to address your question, I want to make some reflections. First one is that I think that investing in prevention is central to achieve sustainable development in low and middle income countries. By investing in evidence-based prevention, countries can improve living conditions, foster healthier communities, accelerate progress towards several SDGs, ensuring health and lives and well-being, promoting quality education, reducing inequalities, and so on. So in this sense, I think prevention is both a health strategy and also a development strategy. And this decline in global funding is a real challenge because, in my view, that is also a reminder that countries, especially like mine and other low and middle income countries, need to focus on what is most sustainable, and that is building strong evidence-based prevention systems. When we talk about drug use prevention, we are not only reducing consumption, we are protecting children, strengthening families, and giving communities the tool to be healthier and safer. The evidence is clear. Prevention is one of the most cost-effective measures we have in public health. It reduces future treatment costs, and it creates long-term social and economic benefits. In Latin America, we have seen that when prevention is integrated in primary health care, education, community services, it becomes more resilient and less dependent on external aid. But for that, we need a real system. This means governance, standards, trained workforce, monitoring, etc. Not just isolated projects and not any prevention. We need evidence-based prevention and mostly evidence-based prevention systems. And as you said, Wadid, there is already global recognition of this because in the last CMD, Chile presented a resolution on prevention system, and this resolution received massive support, even in this current climate of multilateral tensions. And I think this shows that countries do agree on the importance of building and strengthening prevention system, and it gives us a mandate to continue advancing together in this direction. And here is where the principle of common and shared responsibility is a key. Cooperation is not only about money, it is also about sharing knowledge, building capacities, and learning from one another. South-South cooperation has shown us the power of exchanging experiences within our own region. At the same time, we must acknowledge that countries with greater resources also have greater responsibility because global health and human development are collective goods. When one region invests in prevention, everybody benefits. So to answer your question, yes, prevention systems are the way through. They optimize and amplify prevention effects. They allow us to keep momentum even with fewer funds, while reminding us that behind every program, there is a child, a family, a community that deserves hopes and opportunity. Thank you.
Thank you very much. I mean, indeed, I mean, to kind of, summarize the very important highlights that you have mentioned, when you zoom in from a concept of drugs, yes, it is a core component that reduces treatment cost moving forward. But when the broader spectrum in terms of this investment is being done in terms of health and development strategies, the number of counterparts that are part of that response is broadened, and the investment in this and the number and the willingness to kind of share the burden of the prevention response is broader, and that's where the system comes in place and the common and shared responsibilities. And it's also highlighting also the overwhelming feeling in terms of the importance and value of this investment now. In the context of tense multilateralism, there's still a common understanding and common ground in terms of the importance and value of prevention. So thank you very much for that response. And with that, I move now from a civil society perspective as well to add to the discussions being mentioned. And I pass the floor to Ms. Ingeborg Thorstidottir. The question will be more on how can young people be more actively involved in co-creating or potentially implementing drug use prevention efforts? And in your experience, what is essential in fostering this youth leadership in terms of prevention response? What kind of support, whether structural, skill-based, or institutional, are needed to make that effort more effective?
Good morning, and thank you for the question. First of all, my name is Margaret Lilja. Guðmundsdóttir, also a daughter from Reykjavik, Iceland. But great to be here with you today, and thank you for inviting us to this space. I'm glad to see you again. We missed you online. I want to highlight in the beginning that young people must be seen as active partners in shaping today and the future. It is important that youth not only have a seat at the table, but are genuinely involved in conversation and decision making. I think it's too often that youth is only giving a seat during special events and designated days. So we have to look at children and youth must not only be visible, but also truly listened to. Gathering data from young people, children and youth is one thing, but being willing to listen and act on their voices and what they are telling us is another thing. We could talk about co-creation. We have to make sure that we are inviting youth to participate in designing prevention strategies from the very beginning. We could mention survey design, that we are asking the right questions, that we have all the topics that are relevant. We want them also in our team when we are testing the message that we are sending out, local campaigns, for example. And when their ideas shape the process, outcomes gain authenticity and relevance. Another thing I want to highlight is leadership. Youth leadership grows when adults listen and step back. Structures should make space for youth advisory boards, peer-to-peer initiatives, and platforms where young people can influence policy discussion directly. And what maybe needs to be done, we could talk about, like you already mentioned, the 3 forms of support, structural. We have to make sure that spaces and frameworks where youth voices are institutionalized, not optional. And in that, I could, for example, mention youth councils linked directly to municipalities or NGOs. Skill-based training and leadership, communication and advocacy, so that young people have confidence and competence to stand as equal with professional. And then institutional long-term commitment and funding that signals this is not a youth side project, but a center pillar of prevention. And it's clear that it is my experience that prevention becomes stronger and more sustainable when youth is part of the conversation, because of they know their own culture, risk and realities. And we also know about the digital space that is kind of their own world, and we are maybe not part of it. So thank you.
Thank you very much, Margaret, and I do apologize. I misread the
no worries.
Okay, and exactly your points are just to summarize. Listening is a key component in terms of moving forward, but also having the right questions in mind, and this would require to go back to what Mr. Theokaris was mentioning as well, having the data and knowing what kind of challenges are being faced, but also giving them leadership in the role for the youth and having an institutional role in that leadership response as equal professionals in terms of as an equal counterpart in terms of moving things forward, because it's an asset that needs harvesting and harness their power in terms of youth, not only as recipients of the response, but as participatory agents of that response. So these are great points. If the time will allow, I'll make a short second round of questions, but hopefully, we will have maybe a bit of a briefer, but it's important sort of follow-up questions to go back to the same panel again with the second round of questions. And let's start again with you, Professor Gordon, Francis Grace. The challenges in implementing evidence-based drugs prevention, particularly in the time that we're facing right now, unfortunately, of rising crisis. What could be a suggestion to overcome such challenges and argue for the importance of investing in prevention now in such challenges?
Thank you very much for the question. I consider these challenges as opportunities for growth. And of course, aside from constraints in resources and competing priorities, one of the challenges is actually the fragmented approaches to drug prevention. Another one is, of course, the lack of political will in some of the governments. and the lack of capacity building activities, especially for our prevention professionals in the field of monitoring and evaluation, which is considered as the backbone of prevention science. So some of the suggestions that I can provide is to harmonize all these efforts that we are doing in drug prevention. At the same time, integrate them into existing mechanisms so we don't reinvent the wheel. And again, going back to the whole of society approach, which is really the cornerstone of evidence-based prevention. Let's remember that through our concerted efforts, we can move from a reactive response to a more proactive response to drug prevention. Thank you.
Thank you very much. Also excellent points in the sense of in this time of need, when the investment is limited, it is the time to kind of bring all of these fragmented approaches together and at least harmonize the efforts that are already being invested in and integrate them in a one unified approach. And with that, I pass the floor also to a further highlight for Mr. Theokaris. Thanasis, with regard to the policy perspective, how can prevention be coordinated across different sectors, knowing that different national stakeholders play a different role when it comes to implementation on the ground? How can we bring these people together?
Thank you, Wadim. As you said, we will not reinvent the wheel. And this is an issue. Prevention can succeed only if it's a whole society effort. This is very crucial. For example, in Greece, we have several coordinator actions, like the interministerial coordination that we have. The national committee that we have for addictions brings together 11 ministries, the EUDA focal point, the civil society. For the first time, we have participation of civil society and the users' opinion. And this reflects both expertise and lived experience. Secondly, we should speak for integration with education. Prevention modules should be introduced within the education system, within schools, within the educational curriculum. This is very significant. And projects as CHAMPS, they support this kind of participation and inclusion. We will engage children and adolescents from early childhood to 18 years old for every aspect of their life. Another part is the community level partnerships. We have, with all the prevention centers that we have in Greece, for example, we can make prevention a shared responsibility at local level, with local actors, with local leaders, and having or being supported by associations at local level, which is very crucial for prevention system. And last but not least, we have to have digital coordination. With all this environment, with all this context that we live, the drug markets moving online, the prevention strategies are preventing to reach young people with a different way, through social media, through digital platforms, or other ways that in the past we didn't have to do so. In this context, for example, in Greece, we have created the first national monitoring observatory for digital addiction that will help us to understand and to acknowledge all the existing trends that we have, as well as to the cooperation that we have with the independent authority on gambling and betting, which is also very crucial for us for the illegal gambling and gaming. So if we follow and support initiatives like CHAMPS, for example, that they have these methodologies and this cross-sectoral approach, It's a new way. It's a more holistic way in order to approach and to address all the nowadays needs of young people due to all these drug addiction evolution that we have and addictive behaviors in general, and create a new setting. Thank you very much.
Thank you very much, because I mean, this is an important point in the sense of, yes, there is a need for a top-down, bottom-up, so if I understood correctly, approach where there are coordination entity in place, but it needs to be activated in terms of the different committees to kind of bring together the need to better coordination and to expand also, not only governmental, but civil society organization, academicians, and community leaders, and maybe children and youth themselves in such response. But also, you have mentioned as well an important point. It's also there's going to be an articulation at the local level, not only at the national level, in terms of systems of prevention, bringing different counterparts and make me realize what do they have to bring to that system, and what that system can provide to them over and beyond just drug prevention, as you mentioned, in terms of broader spectrum of maybe even addictions where their interest is, you know, on other forms of addiction, not only drug related, and these things would provide a more kind of an approach for coordination. So with that, maybe I can move the floor again to Francisca and go back to Chile, hoping the connection is still stable. Francisca, how would you reconcile the use of standardized prevention frameworks, such as, for example, the international standards, with the need for local adaptation of such standards? So basically, how can this evidence that exists in terms of science be maintained in terms of translated on the ground with fidelity and ensuring relevance of that global science nationally?
Thank you. I'm here. I'm here. Connection is still good. Thank you. The first thing is, I think that international standards give us what works and why it works, while the adaptation defines how we can do these prevention programs. And I think there are many things you can do to keep the fidelity. Like, first of all, you have to identify what is the core components versus what is adaptable elements. Like what and that's what the standards are for. Like, you can't change the skills in the family training or in the life skills, but you can change how you develop this with the community, in the community, etc. In Chile, we have adapted our parenting program to communities that are indigenous communities, and it's been very interesting because what we have learned is that you can bring more people or other views, but what is core in this kind of prevention programs hasn't changed, you know, like what the skills are in the family process. I think another way to maintain fidelity is with using a participatory process to anticipate. If you want to adapt a program, you have to do it with the community, with the local setting, with youth, as we saw before. You need capacity building and training, and also using lots of feedback loops. I think piloting, it's a very good thing to do. And so what I basically am saying that the standards are crucial because I insist that's what tell us what works and why it works, while we can talk about how we deliver the programs in a more comprehensive and more sensitive cultural way. Thank you.
Thank you very much, because this is a very common question that, you know, that science comes from one part of the world, and is that science transferable in that? And it is very important to kind of reflect from your experience in terms of exactly that science is describing it, as you mentioned, what works. How it works might require a bit of natural reflection, but also I would also mention the fact that that feedback loop mechanisms that you have mentioned is a key to generate further research. And I go back to the first point that you have mentioned in your previous question in terms of like that engagement in terms of South-South collaboration to kind of generate more research from the global south in terms of this transferability of science, I think is key in this new era of prevention. So with that, I pass the floor to Marika. Ms. Ferry, the second question that I have to extend on the previous question is, what is the next frontier from an EUDA perspective? What is the next frontier in terms of prevention, research, and practice? Perhaps new technologies that are effective in reaching youth through prevention messages, better strategies to address the quality of the prevention structures. What could be the new frontier that would reflect on in terms of a couple of initial priorities?
Thank you very much, Vadi. This is a very stimulating question. So the new frontiers of prevention research are shaped by rapidly evolving societies. While it remains essential to consolidate existing knowledge and assess interventions over the longer term, prevention must also adapt to profound social transformation through systemic approaches. These include increasing cultural and linguistic diversity, changing work patterns, and the emergence of new lifestyles and social groups. Such shifts are reshaping behaviors and vulnerabilities in a way that differs significantly from only a few decades ago. Technology is a key driver, it has been said before, of these changes, particularly for young people, whose social interactions increasingly occur within online and virtual communities. But it can also create new types of social exclusion at the cost of social capital. Prevention, therefore, needs to be responsive to new languages, perceptions, and modes of engagement specific to younger generations. At the same time, the emergence of new psychoactive substances requires adaptations to existing strategies to maintain their relevance and effectiveness. To meet some of these challenges, prevention research must foster platforms for dialogue, exchange, and collaboration among professionals across different sectors. Our EUDA European Prevention Curriculum and the e-learning platform Plato are aimed at that. Policymakers are increasingly calling for evidence-based interventions with clear and measurable outcomes. We must respond effectively to this demand, providing training and opportunities for exchange about best and bad practices. Thank you.
Wonderful. Yes, exactly. I mean, the landscape is changing, and the youth, in terms of the landscape of drugs, is changing rapidly, and at the same time, the engagement and the socialization is changing rapidly, and how we can adapt the tools that we have to these new lifestyles, I think, is key. But thank you for also mentioning the presence of specific platforms where this kind of brainstorming in terms of how to address these packages and address, including within the EUDA, are key in terms of moving that scientific agenda forward in that context. So with that, I move to the last question that we have in terms of panelists, and I move again to Ms. Margaret Goodman-Storir for a question regarding the civil society again. We see a bigger coalition coming between civil society organizations growing. We heard about, for example, the Oviedo Declaration in terms of engagement as a civil society with regards to prevention. Civil society coalescing together and coming together to call for the importance of evidence-based prevention and better partnership between governmental and non-governmental counterparts for a common objective. How can you see from a civil society perspective such momentum moving forward? What could this potential bring to the agenda of prevention?
Thank you. Thank you for this question. In my mind, this is team building. I want to start by addressing that. We are acting as a team. It's team building. We know the challenge is big and it's growing, like already mentioned here this morning. And the challenge has lots of resources and capital. And in Oviedo Declaration show a growing recognition that prevention is not an isolated activity. I think that's important. It's shared responsibility. And governments, they bring laws and resources, but civil society brings innovation, community trust, and flexibility. So when this comes together, prevention gains both scale and depth. Moving forward, we need to strengthen evidence-based prevention as the common language of cooperation. making sure that we are building coalitions that are broad enough to include not only drug use or drug prevention, but also talk about education, health, youth work, and local communities. Use joint declaration like Oviedo as living tool, not just signature on paper. So what this can bring into the momentum is a stronger united voice calling for prevention, making it harder for policymakers to ignore, and opening doors for sustainable investment and global commitment.
Thank you very much indeed. With the growing challenges and this kind of happening, these resource capitals that are driven by the civil society is key. And I think this spirit of coming together as a global voice has been key. But as you mentioned, translating that global voice into a larger commitment at the national and global level, and making it as a living platform to harvest that investment moving forward is a key and much welcomed actually commitment of multilateralism as a civil society as well, not only multilateralism in terms of government. So with that being said, if we go back to the agenda, we have a few minutes left. So with your permission, Mr. Chair, I don't know if we can allow the floor for what do you plan to do? If there's any question for the panel before.
Yeah. Well, thank you. Let me maybe start off this discussion and also maybe a word to the Secretariat for the future panels. So thank you, Mr. Baloof, and all the panelists. But I think it's important for all of us to know that this is a unique platform that we have in the CND thematic discussions, where you're bringing in research capacity, civil society, to talk to actually a lot of policymakers in the room. And my submission to all the panelists would be in future to try and have more pointed interventions that urge specific actions by policymakers. I think most of us are well aware of the larger issues here. And then in that context, I had a specific question. One of the issues around prevention strategy is the question of measurement. Particularly when you look at primary prevention strategies. How are we, because, you look at as a policy maker, you need to have accountability in terms of resource allocation. That if your resources are limited, you're asked to allocate between A and B and C. Why should I allocate to A, prevention, if I cannot measure the impact? So what are the innovations that are happening? And if some of the civil society representatives could also come in. And this is why I say it's important to highlight new innovations in areas that can be scaled across different geographies and cultures. So that's my question, my 2 bits. And maybe we can then encourage the rest of the floor also to join in the discussion.
Would you like your question to be addressed by the panel first, Mr. Chair? Okay. Maybe anybody from the panel would like to address that question? Because I might have some thoughts, but I think it's better to address it to the panel first. I cannot monitor online, but please.
So, for example, we have in Greece this kind of monitoring system lately. We had all the prevention scheme for many years, but we didn't know exactly what you asked for. How this scheme was sustainable, this was measurable, and all these feasibilities details. So we created a system, a platform where we know exactly on real time what the prevention scheme, the prevention centers do, how many people, if it's a focused intervention, if it's a more general population intervention, how much this cost, and how many resources we used for this intervention. For example, it might be too detailed, but it's something that we should know, and especially policymakers and politicians want to know that. And as I told before, this is not something that we see in the near future. We see it very far away, And if we know how much money we spend and how many resources we have in order to address the needs, it's much more easy to judge, to be more critical, and to allocate sometimes into different needs that we have.
If I may add to this context as well, Mr. Chair, I mean, the question of accountability is at two levels. There's the question of the ongoing investment and showcasing that this investment is going in the direction that is effective as a transparency process in terms of policymakers. And we have all the tools now that help policymakers make that informed decision through a tool called the review of the prevention system that maps out every single investment and how much it matches in terms of a service or does not match the prevention standards, at least from a starting point, to tell them where it should go. And the second thing is that investment is not only in terms of what the services are, but who are we serving? And we have services that are for all the population, universal prevention. There's our selective intervention for populations that are living at higher risk than the others. And there is indicated for those that have symptoms that need to be addressed. So is that investment actually also not only is aligned or not aligned, is it leaving no one behind? That's the other element. And this is going sector by sector. The other element is not only on the softwares in terms of what works, but it's also on the hardware. How is that system functioning? How much coordination there is, how much the sustainability, how much the legal framework at the national levels facilitate an investment moving forward. All of these are questions in terms of accountability that help policymakers ensure that they're doing what they're supposed to do and investing effectively. But also we're trying to generate data, showcasing that this investment, and this is where the CHAMPS initiative comes in place, is not an initiative that showcases just that investment in preventing drug use. How are we at the ecological level, at the state municipality level, through this investment as a system, showcasing changes indicator of children and adolescent development beyond just drug prevention, mental health, criminality, violence, and beyond. All of these are questions of accountability that also reflect from policymakers that this investment is an investment that is making a change in the developmental trajectory of youth. So,
thank you for that. I'll now open the floor for any comments to the panel. Any questions? Yes, Mexico.
Thank you, Mr. Chairperson. Good morning to you and to colleagues. Two questions. Thank you for the presentations. The one addressed to Angela. Of course, you were not leaving unscathed. The political declaration of 2009 established as a commitment to eliminate and reduce significantly and measurably the illicit manufacturing of psychotropic substances, including synthetic drugs. And you have mentioned that the issue of abuse or addiction has to do both with controlled medicines or controlled substance and non-controlled. So have you worked in your section or with your partners in developing indicators to address that issue of measuring the reduction in the illicit marketing? For Wahid and the panelists, operational recommendation 2 of UNGAS 2016 speaks about expanding the distribution networks for guaranteeing affordability and accessibility of medicines to everyone, particularly in rural areas, but also speaks about providing the proper training for healthcare professionals for prescribing properly or not over-prescribing medicines, either from controlled substance or not controlled substances. So what are the measures that you have taken, Wahid, in terms of UNODC for providing training, capacity building, etc., and our distinguished panelists, if they have examples in their countries to address this issue? Thank you very much.
Thank you, Mexico. I think we'll go question by question because as we get too long. Ms. May, you want to respond to that?
That's a good question. We don't have indicators to quantify whether, to quantify the size. But what we do, we triangulate information using, seizure, price, use, etc. And through the triangulation, what we can say is only the trend. And that's why I said we can say that is increasing. How much? That we are not able to say. Thank you.
Mr. Malouf, your...
Thank you very much, Mr. Chair, and thank you for the District of Mexico for the question. With regards to the health response, we have 3 specific programs. I mean, what I addressed now is more on the prevention, which is substance neutral in the sense of building resilience, not to engage in any sort of substance use. But when it comes to specifically access to medication that are under international control, we have a specific program in terms of improving access to those that need these substances for medical need, while averting diversion to the illegal market, and have a specific program for that clientele. I focused more in terms of prevention in the sense of prevention of initiation in terms of particularly the adolescent and youth, but I think probably in the session when we go into the access, there will be a better discussion with regard to that specific subpopulation that you have addressed, distinguished director.
Colombia. Thank you, Chair, and thank you for convening this meeting, and thank you for giving us the floor, and thank you to the Secretariat and to the panelists. Ms. May, all the best and in the future. We have a question, Mr. Chair, and it is, Ms. May was crystal clear, drug use has been increasing over the time, so why all of our efforts on prevention has not been working? What is the problem with them? Why we don't see the results that we expect? So I know that the panelists mentioned that this is a cost-effective intervention. Yes, it is, no doubt about it. But why are not we seeing the results that we expect on all of these investments that we are making on this matter? This is for all panelists. And also, I think that it was Ms. Duca Pante mentioned that one of the problems that we have is fragmentation. But at the same time, I would like to ask how we can avoid fragmentation, but at the same time address the particular characteristics of the targeted populations that we are trying to address. For example, in matters of age, in matter of the type of drugs that has been used. Ms. May also mentioned that we are seeing the increasing of non-medical use of pharmaceuticals, how we can address that from a targeted way without, and at the same time avoiding fragmentation. And I think that it was Mr. Theokaris, who mentioned that it is important to also develop measures on prevention, taking into account the new information and communication technologies. And I would like to ask you how we can measure the effectiveness of interventions on prevention that we do using those platforms in a way that we can see the results that, as we said at the beginning. Thank you very much, Mr. Chair.
Thank you, Colombia. I would personally say that asserting that prevention hasn't worked seems to be a bit excessive in terms of the criticism. Of course, one could argue that if you didn't have prevention, the number of users would have been 3-fold or 4-fold. Mm-hmm. So I think the more important questions that you raised also in terms of what works, maybe I'll pass it on to Mr. Malouf, and maybe he can coordinate with some of the panelists to answer those.
Thank you very much, Mr. Chair. I mean, I will open the floor to the rest of the panelists, but at least on the question of prevention, it's, and I think in the presence of Angela, who's the expert here, part of this increase in terms of number of users is related to population growth per se, and not only in terms of prevalence of increase, but also when we say investment in prevention, it's also important to think in terms of what kind of investment we're doing. And because we know intervention by intervention, as per the applying WHO standards of evidence, we have effective information by WHO standards that every single intervention in the standards have significantly contributed to preventing drug use. And we know that the more we add interventions, one intervention does not overtake the effect of the other. There is an amplification of the effect of the prevention. Of course, there's not one prevention intervention that can deal with all the vulnerabilities, but the more we have intervention addressing different vulnerabilities and actually addressing different ages of development with different needs, the more the effect of the prevention. So that evidence in terms of effectiveness is there. With that, maybe I can pass the floor to the rest of the panel to add to this element of terms of effectiveness, but there's also the fragmentation that we directly want to mention to Philippines and the message of technology and advancement also went to Greece. hoping the time will allow, but I'm sure we will have more engagement with this effect. But maybe at least I will pass the floor to Philippines and then Mr. Teocaris as well.
Thank you. I think communication really is the key because a lot of agencies are doing prevention work, but they're not talking to each other. So go back to the table and harmonize all these efforts so that we can actually respond to the fragmentation issue. Thank you.
I think the Colombian delegate mentioned that fragmentation may be necessary, if I read him correctly, because somehow it's not possible to always have a harmonized approach. Yes.
Thank you, Mr. Chair. It is how we can avoid fragmentation, but taking at the same time the need to target specific populations, specific drugs. We see that in different segments of society, there is not a single way to address the prevention measures that we have. So how we can manage those two things. Thank you.
Thank you.
So going back to my answer on really talking to each other, for example, the Ministry of Health and the Drug Prevention and Control focal point can really come up with a strategy so that the mechanisms are well integrated and it's harmonized in terms of approach. I hope I was able to answer your question. Because, for example, in the Philippines, tobacco and alcohol is managed by the Ministry of Health. Then we have the Dangerous Drugs Board, which is in charge of illicit drugs. So there's really a need for them to coordinate.
Thank you. Grace, please, Mr. Teocaris.
So, one point is that, as Marika said, that we had this evolution of societies, and this is very rapid. And the other is that we have all these cultural diversities that also are developing rapidly as well. So concerning the technology and what we can use, we can use many new tools. For example, we can use AI. We can use things that technology can give us, such as algorithms. For example, in Greece, as I told you, the platform that we will have, we will implement, is going to see all the aspects, all the patterns, the trends that the young people have in concerning their uses, the drug use or their addictive behaviors, and this will come as a feedback back to us. Especially, we will have specific and targeted as well apps. Applications for alcohol or other behavioral addictions. And one other thing that we've done in Greece is Kids Wallet, where we have an age verification of people, and in November we will have a common act for age verifications for children in social media. We will stop from a certain age the use of social media. So these are from many aspects, from many points, that info, that feedback that we want to have. There is the way. We have to use the technology on the round back.
Mr. Balu, I think I'm told by the secretary that our colleagues who are joining online are feeling a little left behind. Maybe they could also come in. I believe they also want to respond to the somewhat provocative point that I mentioned. Miss Oblitas can start off. Chile. Yeah, you have the floor.
I want to say is that prevention works, and I think we have still have little invest in prevention. So it's important to have more invest in prevention so we can see more programs in the Global South, and to keep monitoring, because I think it's a problem that we have no fundings for monitoring, evaluation, and so on. So people may think that prevention not all the time works, but it works. And the second one, in the fragmentation, I think I will go back again on the prevention systems. In the last CND, we discussed the resolution. The resolution is there, and we talk about cross-sectoral system and a view where everything integrates. So I think that's a very good answer for the question that the Colombian delegate asked us. Thank you.
Now, Ms. Ferry from EUDA.
Thank you very much. I really appreciated your provocative question because we need to be concrete. I mentioned before we have a new class of policymakers that want to do well. We need to support them. We at the European Union Drugs Agency have a registry of evaluated prevention programs called Exchange, where people can submit their program to be evaluated. We find the evaluation studies and we score for the certainty of success. It's something that is evolving. We will soon change the protocol to make sure that we not only base on programs, but we can also broaden up to systems and approaches. The strong part is that we not only score the evidence, but we also provide tips for implementation from the implementers that can be contacted. So who is willing to implement one of those programs can see what is the evidence in support and can talk directly with the colleagues in another country that have already overcome all the possible barriers. This is one point. About the effectiveness of prevention, another very nice provocative question. If we look at the ESPA data, the European survey for school children, we see that there is a reduction of the use of drugs. What has been mentioned before is that other behavior are coming up. So, for example, gaming and the use of technology or the vaping. So we have an effect and we need to become better in communicating the effect and to enable our professionals to be able to clearly communicate the effects. But the challenges are never ending because it's an evolving society. And so we always need to keep alert and to be able to respond. Thank you very much.
Thank you very much, and particularly for flagging the kind of emerging interlinkages between different kinds of dependencies and addictions. Mr. Maloof, you wanted to add something? No. We now have the European Union, which wants to take the floor, please.
Thank you, Chair. I asked to take the floor for a statement, not for the Q&A, so I think it was for after.
We'll come back to statements later. Anybody else who wants to get into this discussion? It's getting very stimulating. Yes, go there. Who do I have there? I can't see your nameplate. Oman, please, you have the floor.
Thanks, Chairman. My point is actually what it has been succeeded in my country. The involvement of the community. We have community like some sort of, we call it in Arabic, musabaqa mujtama'iyya. Challenging between communities, actually. So each community, it has come with different programs based on the need assessment of that community. Some of them, they have the triggering factors, but they don't have the problem itself. Some of them, they have the problem itself. So each community is presenting the program which is tailored to that community. I think this is one of the main effective way of targeting community. Thank you very much.
Thank you very much, Omar. In this context, I invite your attention to one of the initiatives that we have going this year of sharing success stories. Because a lot of the debate is always about what is not working. I think some of the debate should also be about what is working. So I think what you mentioned about having these communities sort of have a peer-to-peer competition, if you will. These are success stories that can be taken to other contexts. So I request you to maybe submit your success story to the Secretariat. We now have an intervention from Russia.
Thank you, Chair. First and foremost, allow me to join other colleagues for thanking Angela for her tremendous work in the CND and I mean the contribution to the CND work and achievements and progress made in the UNODC in terms of research. We associate Angela with the whole research work here. We know that there is a big team behind you and brilliant experts, but without your commitment and your coordination of this work, there would be a huge gap in evidence and in the progress made. And I also wish you all the best in all your future endeavors. And we will miss you a lot, Angela, because for us you are a kind of cornerstone, not only in the CND, but in the research activities of the office and the UN system in general. And with regard to the topic of prevention, firstly, I would like to ask distinguished panelists what do they think about digitalization and the use of social media, because we have heard that this is a new factor which should be taken into consideration, and whether you consider it to be more a challenge in terms of marketing of drug abuse and distribution of drugs and misperception of risks, or whether we could turn this challenge into an opportunity in terms of work with young people and broadening outreach activities, and which challenges do you face and how we could overcome them, because definitely we need to adjust our efforts to all the modern developments. And also I have a follow-up remark to what our distinguished colleague from Colombia mentioned. We believe, firstly, that definitely without prevention, the figures which we have seen on the screen would be several times higher. And it is difficult to measure the effectiveness of prevention, but prevention definitely works. And in the view of my delegation, both the UNODC and the CND have progressed a lot during the recent years in terms of conceptualizing prevention, bringing different elements together, and CHAMPS is the best example of it. And we are looking forward to receiving results of first CHAMPS pilots launched in different countries, and I believe this would be a crucial point where we could talk about real progress in terms of prevention, when all the elements are there, the political will and the relevant funding. And definitely we are also at a very crucial point when the progress may reverse just because of the lack of funding nowadays. And we believe that all member states should continue to support these programs both at national level, but also providing support to relevant UNODC activities. Thank you.
I thank Russia. I now invite Ms. Margaret Goodman's-daughter of the Vienna NGO Committee for some comments. Your mic is muted.
Hello.
We can hear you now. Please go ahead.
Okay. Sorry, just quick. I just wanted to echo what my panelist colleagues already mentioned, that prevention works. Absolutely. We also know that we are only spending like 3% of the resources that we spend into prevention in primary upstream prevention and health promotion. And that's another thing we want to highlight. We see reduction in substance use where I'm coming from, located here in Iceland, but we also have to realize that prevention is not a single project. This is a long-term work and it needs to be holistic. And we have to work on it every day, not only when we have some crisis going on. And we have new challenges, echoing what already mentioned from Russia, that we see digital space is a growing thing. Our youth is being marketed, and they are actually the target group. And there's another space that we need to step in and create more policies and regulations so we can support and protect our youth. Thank you.
Thank you. I now give the floor to the representative of Romania.
Thank you, Chair. Thank you, first of all, to all the presenters on the panel. Very, very interesting information and definitely useful. And good luck, Angela, going forward. I'm sure you will have other things more interesting to explore. And thank you for all your efforts here. My question relates to previous ones, especially in terms of digital media. Of course, scientific data shows us that media campaigns in the digital sector aren't that efficient, but still, as we see in Romania and other places as well, it's still a very used channel in terms of prevention campaigns. So I'm curious, and this question is to any one of the panelists, whomever you consider, is there any type of digital media campaign that has proven efficient in the past, or is it something that we are still analyzing? Thank you.
Mr. Malouf, would you like to take that?
Thank you very much, Mr. Chair. And indeed, to address both the questions of Romania and Russia with regard to this effect, the online community is a community like any other community. It has also its vulnerabilities and requires an addressing, like you're addressing prevention in any other community. And the level of vulnerability is there just for being in that community and not receiving the information that you need. So the social media space is something we are exploring into more details. We have undertaken an expert group meeting in terms of how social media can be used from a prevention perspective under what I mentioned before, the Prevent Alliance. That expert group report will be available for you all online soon. And what we're trying to do is trying to see how we can use the scientific experience we have from the standards in terms of articulating the prevention science in an online social media platform, knowing also the good and the bad in terms of that people can be online. But of course, we cannot deny the fact that there is a big community of youth that is engaged online. How to address them, how to build their resilience through their presence within that community online is something that we will be doing within 2026. And, this is something that was announced actually with the Prevent Alliance in the General Assembly just last week, in the sense of that guiding document that we intend to do within next year, of how prevention campaign can be done within the social media, and with also a piloting that's going to happen to explore more how this can move forward. So definitely this is work in progress, but the critical thinking of the youth remain a core ingredient that we would like to focus on. It's critical thinking. It's not the information that is missing. Information on drugs is out there. Everybody knows everything about drugs, but unfortunately the youth now are relying more on search engines and think tanks like artificial intelligence tank that, ChatGPT is more of a resource in terms of information than any ministry or UNODC or WHO or any other source of information. How can we have the recipient on the other end critically analyze this information and teasing out what's wrong and what's right remain at the core of the work moving forward. So with that, I pass the floor back to you, Mr.
Thank you. I also want to go back maybe to Ms. Goodman's daughter and ask her about the issue of stigma, maybe also the representative from Chile from two different contexts. Because one of the challenges that we are facing in the issue of prevention is addressing some of the stigma, and particularly with relate to tertiary prevention. And I'd like to seek their comments on that.
To agree, there is an issue regarding stigma. I'm coming from the primary prevention. That's my work is all about that. So looking into upstream and health promotion. And I see it also when I'm speaking to parents, for example, that if they have a child that is struggling or dealing with substance use, they are also facing a stigma to be part of of the work that is going on in the community. So I think that's something that we have to work on, not only related to drug use, but other things that people are struggling with and dealing with. So probably have people in the panel that are more suitable to answer this question.
Ms. Oblitas, would you like to come in?
Yes, thank you. Can you hear me?
Yes.
Okay. Yes, big issue, stigma. I think that we have to work together. For many times, prevention has been addressed from a very dark place, like scaring people or giving very bad messages about what consumers are. And I think that's been a bad thing. And so we have to move forward in prevention for more likely place, not scaring people, being serious about what the risks are, and have more evidence-based interventions, for instance. And we have to address stigma. We have to have programs that address stigma, because there's many kind of stigmas, but one important one is the one that professionals have towards people that use drugs. So when we have school-based interventions or community-based interventions, we have to talk with that community about what they think about people that uses drugs, so we don't get to them too late. So I think it's a very important issue, and we have to make efforts also to address that.
Okay, the EUDA representative also wanted to comment on this matter. Marika, you have the floor.
Thank you very much for the floor. I was reacting on the media campaigns part. I feel a little bit of responsibility because I authored a systematic review about 10 years ago about the risks of media campaign not reaching their target. The world has evolved a lot. Has been said before, what we need to do is to make sure we are speaking the right language to the right target population. Is an area that we need to address, and we need to work on it. So it's very interesting. About the stigma, just to say something about it, we have in our new mandate as an agency, first of all, we have the overall guide of the European drug strategy that is an excellent way of orienting the interventions. In our mandate, we have for the first time the requests to collaborate with the civil society organizations. And this is extremely helpful to understand what are the possible vulnerabilities, including in our language, to make sure we don't create unwanted risks for stigma. The risk of stigma are obvious. People do not come and seek for help if they feel stigmatized, if they feel excluded by other situations and activity in the community. Thank you very much again.
Thank you very much. Are there any other questions, queries, burning doubts? Okay. If there are none, I think we have had a very, very stimulating... Yeah, sorry.
Ambassador of Ecuador.
Ambassador, you have the floor. Ecuador.
Thank you, Mr. President. I'm also very sad that Angela is leaving us. I congratulate you very much for the hard work that you have given and the reports, the data, because I guess that having a scientific view and data is quite important for the policies that we have to make. And of course, prevention for Ecuador is key, is a key tool to combat drug consumption, and also is important to prevent violence. That is another dimension that we are not value so much in this session. And the challenge, I agree, is how to increase its impact, mainly in vulnerable societies. And this is also is more a sort of reflection than a question directly to the panel, but it is related with education, with health, with the level of poverty, of inequality, and so on. So that is something also that we have to explore, to make some assessments, quite objective and quite practical, in order to fulfill what you have been saying, Mr. Chair, is concrete actions in this scope. Thank you so much.
I thank Her Excellency Mireya Munoz Mera of Ecuador for her comments. And I think we will close our discussion.
No, there is another.
Again, okay. Some after. France, you have the floor.
Thank you very much, Mr. Chair, and thank you to the panelists. Also for France, prevention is important and a key part of our strategy to fight against drug consuming. And we are using many tools, including providing information on products and risks, dissemination of prevention messages, distributing sterile consuming material, supporting users, and analyzing product to limit harm related to consumption in different settings, in prisons, in festive settings, in public spaces, and in streets. My question to the panelists is what tools can we use to target specifically the youth and the vulnerable populations that we know are increasingly using drugs in the prevention campaigns? Thank you very much.
Mr. Malouf, you want to take that?
With your permission, Mr. Chair, may I open the floor to the other panelists to maybe they would have more insight to provide to this effect from your experience, maybe online as well as.
Okay, there are many tools. There are tools, for example, that are integrated within the education system. There are with, as I told you before, the social associated, the local society associated schemes that we implement, meaning that we come into with local associations, with people either of work job association or other association of youth or sports associations, for example. We have many tools, for example, that they are in the specific people who train the youth, meaning the teachers and the professors, which are very crucial for us because they support all this system. And there are other tools that I told you that they would be implemented through a digital, let's say, systematic review of the patterns and the trends that we will examine and look for.
Thank you very much, Mr. Theokaris. I don't know if there's anybody from the colleagues online, Francisca or Marika. No. So I just wanted to add that, most of the work we focus on more on what is on the population that is not using drugs and, prevention messages in terms of building resilience. But I'm sure that when it comes to the health response, when we move to the population, at much we have moved to mostly the indicated level. If there is initial level of use, there is some sort of interventions that can be provided with regards to prevention of consequences. But we focus more on building resilience to avoid use in that panel of discussion. With regards to actual additional packages that once the use is initiated moving forward, there might be other sets of tools to be put in place, but we just probably segmented in terms of the population we're requesting in. With that mentioned, Mr. Chair, I pass the floor back to you.
Thank you very much. I think all of us will agree that we've had an excellent discussion on the issue of prevention. Some short takeaways that I took from this discussion. One, of course, I agree with most of the panelists. Prevention works, but we need more investment. And I think we need to explore a harmonized but differentiated strategy that addresses the granular details of culture, age, various other target audiences that prevention strategies address to. And of course, one key thing that came up is that you look at technology both as a challenge as also an opportunity in terms of devising prevention strategies. So I wish to thank all of you for very excellent inputs and very engaging discussion. I would now open the floor for statements, official statements. The floor is with the European Union. You have the floor.
Thank you, distinguished Chair, Excellencies, ladies and gentlemen. I have the honor to speak on behalf of the European Union and its member states, and Albania, Bosnia and Herzegovina, Georgia, Iceland, Montenegro, North Macedonia, Norway, Republic of Moldova, and Ukraine align themselves with these statements. We wish to thank you for organizing this intersessional meeting. We expect the discussions in the forthcoming days will allow us to accelerate the implementation of our joint commitments. As we meet today, conflict and violence are unfolding in numerous parts of the world, affecting also the drug situation and the public health response. The EU and its member states call for the full respect of the UN Charter and international law, including international humanitarian law, whether in relation to Russia's war of aggression against Ukraine or the ongoing conflicts in the Middle East and elsewhere. The 3 international drug control conventions provide a solid foundation for action in the area of prevention. Prevention is one of the key pillars of the EU drug strategy 21-25, together with treatment and care services for tackling drug demand. In recent years, the drug market in the EU and worldwide has been expanding. Drug use has been increasing, as has drug trafficking, with organized crime groups increasingly resorting to violence, creating a challenging policy context for the shaping and implementation of effective responses. In this context, evidence-based prevention in all its dimensions seems as important as ever. As the preparations for the new EU drug strategies are underway, in the ongoing discussions at EU level, the crucial role of prevention has been repeatedly underlined. We see the need to provide, implement, and increase the availability of prevention interventions and strategies for target groups and local environment in order to increase community and individual resilience and strengthen life skills and healthy life choices. What is particularly crucial is to rely on evidence-based prevention activities with sufficient population coverage and disseminate the latest scientific findings on prevention to decision makers and practitioners, and to provide them with training on what works and what doesn't in compliance with human rights standards. Complementary to what we have just heard from the EUDA, we are also particularly proud of the European Prevention Curriculum, which is a comprehensive training program designed to support professionals in implementing high-quality, evidence-based prevention interventions across Europe. It helps equip practitioners with the necessary tools and knowledge to design and deliver prevention programs that are both effective and ethical. The EU curriculum is consistent with the UNODC and WHO international standards on drug use prevention. We believe that it is important for all countries to continue to rely on such key guidance and recommendations in the development, implementation, and evaluation of relevant scientific evidence-based national programs and strategies, in line with the C&D resolutions focusing on prevention, in particular on early prevention, such as Resolution 65.4 and 68.1. Another important aspect and worrying development is the recruitment of youth by organized crime groups involved in drug trafficking. It is therefore also crucial to address the root causes of this phenomenon by offering education and alternatives to a life of crime through a whole of society approach. The EU will continue to promote evidence-based crime prevention and act appropriately to prevent the recruitment of children in drug-related crime. Distinguished Chair, in order to build healthier, more resilient societies. We must focus on the prevention of drug use, especially among children and youth. Early prevention efforts, including providing education, promoting physical and mental health, and fostering strong family and community support systems, can significantly reduce the likelihood of future substance use and its associated individual and societal harms. And it should be our key focus for the years to come. Thank you, Mr. Chair.
Thank you. I have 15 more speakers and 30 minutes. So I think the mathematics is very clear. 2 minutes each. Peru, you have the floor.
Thank you, Mr. Chairman. Peru considers prevention as a cornerstone of any public health response to drug use. The Peruvian National Policy on Drugs to 2030 establishes 3 priority objectives, one of which is to reduce drug use in vulnerable populations through prevention and treatment services. Within this framework, Peruvian government has consolidated prevention as a key policy priority, integrated it into multilateral plans led by the National Commission on Development and Life Without Drugs, the VIDA, in close coordination with other sectors such as health, education, and local governance. These plans include the implementation of prevention programs in the country's 25 regions, as well as the training of teachers, health professionals, and community leaders, including technical assistance to specialized teams, and coordinating efforts with other sectors to ensure a sustained and intersectoral preventive response. Prevention programs focus on school population, recognizing that early adolescence is the critical stage when drug use begins. Community networks and family-based interventions have been institutionalized, involving schools, parents, and local organizations to strengthen resilience and skills. International assessments confirm that Peru maintains one of the lowest prevalence rates of drug use among school populations in the Americas. Despite these advances, the VIDA identifies 2 key risk factors in prevention that require sustained efforts from Peruvian authorities: early initiation of drug use and limited coverage of therapeutic care. Socioeconomic vulnerabilities, weak family integration, and unsafe community environments are also considered strong determinants of early use and need to receive priority attention. Thank you very much.
Thank you, Ambassador. The next speaker is from Canada.
Thank you, Mr. Chair. Canada is committed to supporting a full continuum of interventions to address the overdose crisis. This includes a strong focus on prevention, and Canada recognizes the importance of public education to support prevention of substance use initiation and harms. Canada has invested over $25 million in public education initiatives, including national and targeted advertising, strategic partnerships, and interactive experiences. The No More Opioids Youth Awareness Campaign engages with teens and youth across Canada on the facts about opioids, the risks of illegal drugs, and the impacts of stigma on people who use drugs. To help prevent and delay substance use amongst youth, Canada has launched a community-based youth substance use prevention program grounded in the Icelandic prevention model, which focuses on building protective factors like promoting strong ties to family, school, and community that promote overall health and well-being. Canada's Ease the Burden public education campaign targets men in physically demanding jobs and aims to reduce the stigma around addiction for this group and encourages them to ask for help. High rates of opioid prescribing have continued to contribute to the overdose crisis across North America. Canada continues to support the development and dissemination of national standards, guidelines, and tools to inform best practices for opioid prescribing. Mr. Chair, today marks National Day for Truth and Reconciliation in Canada, recognizing the ongoing reconciliation process with Indigenous peoples. Indigenous peoples carry a disproportionate burden of the harms related to the overdose crisis in Canada. Canada's Emergency Treatment Fund, launched in 2024, is supporting prevention efforts in Indigenous communities through community-led capacity building and culturally safe, trauma-informed care services for youth. Prevention is critical, Mr. Chair. Achieving meaningful and lasting impacts to prevent substance use requires sustained effort, targeted messaging for at-risk groups, strong collaboration, and continuous evaluation. Canada remains steadfast in our efforts to ensure that all Canadians, particularly those most at risk, have access to evidence-based prevention initiatives to help reduce substance use-related harms, keep communities safe, and save lives. Mr. Chair, with your permission, I would also like to note that Canada is hosting a special event over the lunch break, a panel entitled Collective Action Against Clandestine Manufacture and Trafficking of Synthetic Drugs. And we invite everyone to join on the 7th floor. Light refreshments will be served. Thank you.
China, you have the floor.
Thank you, Mr. Chair. Good afternoon, distinguished delegates. We'd like to say that all the topics under this thematic discussion are very important. Regarding the section 1, the Chinese government always puts prevention at the first place, focusing on youth drug prevention education and building a system that covers the entire population. Firstly, we continue to strengthen drug prevention education in schools. For 9 years, schools have carried out the 5-1 activities, visiting anti-drug exhibitions, holding themed class meetings, knowledge contests, creative works competitions, and watching films or performances on anti-drug themes. Almost 100 million students participate in nationwide drug prevention competitions each year. This has achieved the effect of educating one child, influencing a family, and guiding society. Secondly, carrying out extensive publicity on drug control among all walks of life. We organize drug prevention education in schools, workplaces, families, communities, and villages. Thirdly, improving the infrastructure for anti-drug publicity and education. We continue to develop publicity and education bases with 3,490 anti-drug publicity and education bases established nationwide at various levels. Improve and expand new media platforms, and continuously enhance the reach and influence of anti-drug publicity and education through social media platforms such as WeChat and Weibo. Lastly, we'd like to emphasize drug prevention education again, as it has played an important role in addressing drug abuse, preventing drug-related crimes, protecting people's physical and mental health, and maintaining social security and stability. Distinguished delegates, with the continuous advancement of drug prevention education, the growth rate of drug users in China has steadily slowed, and the scale of drug abuse has been effectively brought under control. Thank you, Chair.
Japan, you have the floor.
Thank you, Mr. Chair and distinguished delegates. Drug control is an urgent global challenge. It not only erodes the fabric of individual societies, but poses a serious threat to the international peace and prosperity. Recognizing this, Japan has consistently prioritized the comprehensive drug measures and working across partnership with the UNODC. From this standpoint, we believe it is a shared responsibility of all member states to implement robust domestic responses, not merely as act of self-protection, but as essential contributions to building a healthier, more resilient international community. In line with our 5-year strategy for the prevention of drug abuse, Japan has placed strong emphasis on the rehabilitation and social reintegration of the people with drug use disorders, particularly during transitional periods such as release from correctional facilities or the completion of judicial procedures. This is a critical windows where sustained support can prevent relapse and promote long-term recovery. To this end, Japan provides continuity of care from incarceration to reintegration, offering long-term support through structured guidance and treatment. Regarding the measures to prevent relapse into the drug abuse, the Ministry of Justice and the Ministry of Health, Labor and Welfare of Japan are coordinating their responses. Specifically, the Ministry of Health, Labor and Welfare is implementing relapse prevention programs, primarily targeting individuals arrested for drug offenses who received suspended substances without probation, ensuring no one is left behind in the recovery processes. Simultaneously, our community-based support system have been strengthened, including the deployment of specialized counselors and the implementation of treat recovery programs under the Addiction Major Community Support Project. We are also investing in the capacity building for the medical professionals, ensuring that substance use orders are treated as health conditions requiring the clinical and psychosocial care, not as moral failings. Japan stands ready to share its experience and the knowledge with the countries and the community in need. We believe that international cooperation in this area is not only a moral imperative, but a strategic investment in global stability and human dignity. Thank you very much.
My next speaker is Colombia.
Thank you, Chair. For Colombia, prioritizing evidence-based investments and public services in relation to drug use and prevention is essential, not only to reduce the negative consequences of problematic use and ensure the protection of human rights and fundamental freedoms of all people, but also as a comprehensive care and public health intervention. From a holistic perspective, it is necessary to advance towards guaranteeing access to early detection, treatment, and care for problems associated with the use of psychoactive substances, and to promote strategies for reducing the risk, harms, and stigma links to such use. And Mr. Chair, you invite us to share what is working. So official data in Colombia show that the consumption of substances such as tobacco is reducing. And and while recognizing the evident differences between those substances that are controlled and those that are not controlled, maybe there is something to learn from that, from what we are doing on that regard. And there is no doubt, Mr. Chair, prevention is key and necessary. Nevertheless, prevention can't be grounded in fear, but in knowledge and evidence. As highlighted by the Special Rapporteur on the right to health, it is essential to recognize that criminalization and stigma do not prevent drug use, but rather exacerbate risks and exclusions. Effective prevention requires accessible scientific information, educational and community programs, and as mentioned by one of the panelists, with the participation of young people. It also requires a multi-sectoral approach that addresses the social determinants of health. Prevention must be understood as a commitment to life and dignity and as a tool to advance towards comprehensive public services that replace punishment with evidence and human rights and integration. Thank you, Mr. Chair.
I now give the floor to Pakistan.
Mr. Chair, Pakistan welcomes the convening of this year's thematic discussions. We thank the panelists for their valuable reflections on the topic of this session. Mr. Chair, it goes without saying that prevention is the best cure. When tackling a complex problem such as drug use, the importance of deploying preventive measures could hardly be overemphasized. Prevention should therefore remain the cornerstone of an effective, balanced, holistic approach towards addressing the world drug problem. Mr. Chair, prevention is a foundational pillar of Pakistan counter-narcotics efforts. Over the years, we have undertaken wide-ranging measures in this area. These include raising public awareness, targeting youth in education settings, community outreach, promoting healthy lifestyles, and capacity building of our health of professionals for early detection. To scale up these interventions through a whole-of-society approach, we have fostered partnerships among families, educators, civil society, and media. We have also leveraged the unique appeal of sport personalities to educate young people about the harms associated with drugs use, including through utilizing social media platforms. In this connection, we would like to express our profound gratitude for the technical assistance extended to us by our international partners, including UNODC. Mr. Chair, we are of the firm view that to be effective, prevention efforts should be accompanied by strong law enforcement measures to counter the drug supply side. Equally, it is important to avoid promoting concepts that are against the principles and objectives of the 3 international drug control conventions. Mr. Chair, by placing prevention at the heart of our collective response, we can easily
realize our shared objective of building a healthier, safer, and drug-free world. I thank you.
The United States.
Thank you, Chair. Okay, the United States remains steadfast in its commitment to preventing the initiation of substance use. We know that the most effective way to reduce the devastating consequences of addiction and related mental health challenges is to prevent substance use in the first place. Doing so not only disrupts the trajectory that leads to substance use disorders, but also helps mitigate the health harms and social burdens that too often follow. The evidence is clear. Substance use and early risk behaviors that take root during childhood and adolescence are strongly associated with chronic disease, addiction, and mental health conditions later in life. Youth substance use in particular is linked to increased behavioral and academic difficulties, exposure to violence, and higher risk of injuries. These challenges compound over time, undermining the well-being of individuals and communities alike. Fortunately, decades of prevention science have demonstrated that substance use, chronic disease, and mental health challenges share common modifiable risk and protective factors. By addressing these factors at the individual, family, school, and community levels, prevention interventions can have lasting and transformative effects. For example, family-based prevention programs have consistently reduced initiation and use of cannabis, alcohol, tobacco, illicit substances, and prescription drug misuse among youth. Moreover, prevention is not only effective, it is cost-effective. Studies show that every dollar invested in early childhood prevention returns $3 in taxpayer savings. Community-wide prevention programming yields even greater dividends, with evidence showing a return of $13 for every dollar spent while reducing substance use, aggression, and other youth-related challenges. By investing early and by working with families, schools, and communities, we can protect young people, reduce the burden of substance use and related harms, and build healthier and more resilient societies. Thank you.
The next speaker is from South Africa. Could you please turn your microphone on? Help thy neighbor.
Is it on? Thank you, Chair. At the onset, my delegation wishes to extend its appreciation to the UNODC for commemorating the 2025 International Day Against Drug Abuse and Illicit Trafficking. Under the theme, the evidence is clear, invest in prevention, break the cycle. We fully concur that prevention remains one of the most essential strategies for halting the flow of drugs and drug-related crimes worldwide. The recent UNODC World Drug Report highlights the burden of drug use and illicit trafficking in the African continent, and South Africa is no exception. Our government has committed to a comprehensive prevention of drug policy rooted in the principles of health promotion, community engagement, and evidence-based interventions. Guided by our own National Drug Master Plan, South Africa has adopted a comprehensive and multi-pronged approach that emphasizes prevention, education, treatment, and rehabilitation. Chairperson, our policies emphasize primary prevention aimed at reducing the initiation of drug use through educational programs in schools, community outreach initiatives, and awareness campaigns that highlight the risk associated with drug use. At the heart of our strategy lies the understanding that prevention is better than cure. Early intervention, awareness campaigns, and youth engagements are paramount in preventing the initiation into drugs use. Our youth-focused prevention initiative called Kimoja, I'm Fine Without Drugs, seeks to reach young people driven by our young peoples themselves to respond to their lived experiences. Through this initiative, we seek to cut future costs by delaying the initiation and uptake of substance abuse among young people. One such example is the rolling out of the integrated online safety program for schools in collaboration with various organizations, including UNICEF, UNESCO, Google, and the Film and Publication Board. The program focuses on training educators on their online safety curriculum guidelines and raising awareness among learners about identifying online harms. We continue to implement the alcohol, smoking, and substance abuse involvement screening test, assist, and online screening self-assessment tool used for substance abuse screening. This has proven to be effective given South Africa's youthful population and their online presence. In concluding, Chairperson, our government has recently established an interministerial committee on drugs and substance abuse to bolster ongoing national efforts in line with our policy commitment, including the 2019 ministerial declaration as we confront the scourge of drug use in our country, including the threat posed by synthetic drugs. I thank you for your attention.
I now hand the floor to Turkey.
Thank you, Mr. Chair. Mr. Chair, the number of people who require treatment for drug abuse is growing rapidly in line with SDG target 3.5 in order to strengthen the prevention and treatment of substance abuse and to promote a society free of drug abuse. We need to ensure the full and effective implementation of our commitments, and we believe that this thematic session will contribute to the implementation of our commitments contained in 2019 Ministerial Declaration. We believe that programs and policies regarding prevention and treatment rehabilitation services of drug abuse must be drafted and implemented with the meaningful participation of all stakeholders at the national, regional, and international level. In this regard, we observed a fruitful collaboration between the UNODC and Turkish Green Crescent Society, which is a member of the Vienna NGO Committee on Drugs, in contributing to the development of more holistic and effective multilateral strategies against substance abuse. Mr. Chair, Turkey has launched 2024-28 National Strategy Document and Action Plan against drugs to be implemented with the coordination and monitoring of the Ministry of Health and in collaboration with related institutions and NGOs. The activities for preventing the demand for drugs is also part of this strategy. As part of our prevention efforts, activities aiming at the protection of children, adolescents, and young people are included in the action plan. A drug combating counseling and support line, which is a public service designed to support and strengthen prevention, treatment, and rehabilitation mechanisms, is available 24/7. Through this line, drug-related counseling and support services and necessary tailored guidance is provided. Turkey also continues to increase the number and capacity of treatment centers. The number of inpatient treatment centers increased by 376% in the last 10 years, while bed capacity have been increased by 121%. Outpatient treatment programs have been implemented in addition to the services of inpatient treatment centers, reaching from 3 in 2014 to 79 in 2024. Moreover, patient waiting times for appointments have been reduced. Currently, patients at treatment centers can be scheduled for examinations on the same day or within 5 days of application. Furthermore, legislative arrangements were made to ensure that addicted patients who don't have general health insurance can have access to free treatment and counseling. Moreover, activities for providing social adaptation services for treatment and rehabilitation, as well as mental support programs and workplace adaptation programs, have been implemented in line with our national strategy against drugs. Mr. Chair, to conclude, I would like to reaffirm my country's strong commitment to our common efforts and international cooperation in combating drug abuse. Thank you.
The next speaker is Thailand.
Thank you, Mr. Chair. Thailand reaffirms that the prevention is an indispensable pillar for public health to address drug use. Our prevention strategy focuses on vulnerable groups, particularly youth, through building awareness and resilience in high-risk zones, schools, communities, and online platforms. Prevention must start early. For early childhood, we promote executive function development through structured EF programs and equip families with effective parenting skills. For adolescents, We launch youth-led TikTok campaigns, Be Smart, Say No to Drugs, featuring short videos on Yaba prevention under the theme, Hug Your Dream, Light Up Your Life, fostering peer engagement and mental resilience. The Thai government allocates 30% of its national narcotics control budget to prevention, reflecting a lion's share of its strategic priority. The Office of the Narcotics Control Board adopts the whole of society approach, working all together with all concerned agencies at its best effort to create safe space, integrate prevention into school curricula, as well as special programs to reach vulnerable groups, including highland youth, as part of alternative development programs done by both our counterpart, the Royal Project, and the Mae Fah Luang Foundation. Our long unwavering efforts yield successful outcomes, with lower and lower ratio of youth as registered new drug users in treatment in recent years. Regionally, at ASEAN, under an ASEAN Narco framework, Thailand administered the data collection and early warning system called the ASEAN Drug Monitoring Network, or ADM system. With high contribution and timely continuous data input by all ASEAN members, we can project the emergent up-to-date situation and appropriate informed responses, preventing our youth and the public as a whole from potential harms more effectively. With UNODC under the Mekong MOU with 6 member countries, the Preventive Education Working Group established in 2023 by China Initiative. Thailand, as the working group chair, actively promote the implementation of relevant program and related activities, including the UNODC initiatives like the Family United and the Friend in Focus. As a member of the CND, Thailand champions evidence-based prevention as a cornerstone of global drug policy. Thailand remains committed to empowering our youth with knowledge, resilience, and opportunity to lead lives with dignity, safe and free from drugs. Thank you.
Thank you, Thailand. I think we now have a bit of a time issue. I have on my list a few more speakers. In case those who want to speak are not on this list, please let us know, the Secretariat know. We have a few speakers: Australia, Morocco, Zimbabwe, UK, Lithuania, Armenia, Israel, Iran, Brazil, Angola, and we have a few others as well, and we'll of course have some non-governmental speakers. So what I propose to do is that we have a small segment called the Pledge for Action, and we will complete that. So let's move to that. I give the floor to those member states wishing to make pledges or report on progress in implementation. And I have a new pledge from the Philippines. May I request you to either make it from where you are or come up to the podium as you wish. Okay, please come up.
His Excellency Shambhu Kumaran, the chairperson of the 60th session of the Commission on Narcotic Drugs, distinguished delegations, esteemed colleagues, ladies and gentlemen, on behalf of the government of the Philippines, I extend our gratitude for this opportunity to address this esteemed body and reaffirm our commitment to the global cooperation in addressing the world drug problem. The Philippines, through the Dangerous Drugs Board, proudly joins the Pledge for Action initiative, committing to reforms anchored on human rights, public health, and sustainable development. Under the leadership of President Ferdinand Marcos Jr., the President has embraced a balanced, multidimensional, and compassionate approach. As President Marcos emphasized, the campaign against illegal drugs continues, but it has taken a new phase, one that prioritizes community-based treatment, rehabilitation, education, and reintegration. Our efforts to advance these policy changes rest on a three-pronged strategy. In the short term, an executive order is being worked out aimed to strengthen the Philippine anti-illegal drugs strategy by harmonizing supply reduction, demand reduction, and developmental services under the rule of law and respect for human rights. In the long term, we're working toward legislative amendments to ensure our policies remain responsive, balanced, and effective. These reforms seek to integrate harm prevention, treatment, and reintegration, improve institutional coordination, strengthen rehabilitation center accreditation, enhance legal processes. One of its purposes is to reduce jail overcrowding and update thresholds for drug possession and trafficking. These reforms are also aimed to streamline access to community-based treatment and rehabilitation, ensuring services are more responsive and humane. The Dangerous Drugs Board leads in steering resources and fostering multi-sectoral collaboration to sustain these reforms. Indeed, the Pledge for Action initiative is a catalyst for progress, and the Philippines remains steadfast in translating commitments into measurable outcomes and stronger protection for communities. Excellencies, the Philippines stands committed to advancing a balanced approach that prioritizes health, human rights, and sustainable development. Through effective national policies, regional cooperation, and international solidarity, we can reduce the harms of drugs and build safer, healthier communities worldwide. Thank you.
I thank the distinguished representative of the Philippines for this new pledge. And thank you. All the best. I now of the pledge.
Muchas gracias. Thank you so much. And thank you, Mr. Chair. It is an honor to present an update from Ecuador of our pledge for action. In 2024, the Minister of Foreign Affairs of Human Mobility of Ecuador, Gabriela Sommerfeld, made two pledges which underscore Ecuador's commitment to addressing the world drug problem, outlined on the 2019 Ministerial Declaration. In reference to our first pledge, establishment of an analysis center dedicated to the control of scheduled substances, subject to control, strengthening, and monitoring of the primary drug trafficking routes within the country through the integrated efforts of its security forces. I'm pleased to share with you that the National Unity for the Investigation of Chemical Substances has established a laboratory for the analysis and research of substances classified as subject to control, duly accredited by the Ministry of the Interior. This laboratory is staffed by police officers with professional qualification and expertise required to serve as chemical experts. Furthermore, a public procurement process through minor expenditure has been conducted in the acquisition of essential materials, equipment, and chemical reagents, ensuring the basic operation of the laboratory in accordance with the protocols for standardized preliminary identification tests. In addition, significant national and international cooperation efforts have been undertaken leading to the donation of advanced equipment for the analysis and identification of chemical substances, including pro-scientific Al-Raman analyzer. Likewise, Ecuadorian President Daniel Noboa ordered the formation of a joint security task force comprised of the armed forces and national police, with the goal of guarantee sovereignty and comprehensive security of land, as well as the air and sea spaces throughout the country. This task force has successfully dealt significant blows to the terrorist, criminal, and organized crime syndicates operated in the country. In its more recent operation, it has carried out the largest drug seizures both on land and at the sea, thereby becoming a crucial support in the fight against drug trafficking. Mr. Chair, Ecuador will continue implementing initiatives to address these challenges led by the President of the Republic and carried out by the Minister of Interior, Public Health, National Defense, Education, among others. Ecuador is determined to confront one of the worst security crises in its history, driven by several factors, including the threat posed by transnational criminal organizations and drug trafficking. Thank you.
Thank you, Ambassador, for that reporting. And now invite the representative of Egypt. It's also a report on implementation. Do we have the representative of Egypt here?
Yeah. Thank you, Mr. Chair, but I think the...
Yeah, please go ahead.
Yeah. No, yeah. A representative from Egypt will report on the implementation virtually. They are now connecting to report on the implementation.
We have somebody reporting virtually from Egypt. Can we have that screen, please? We have something later in the... Could we have the representative of Egypt?
Hello, do you hear me, sir?
Yes, I hear you. Please go ahead.
Yes, thank you for giving me the floor. Ladies and gentlemen, I'm pleased to meet you at the first intersessional meeting of the 68th session of CND. This important event that truly expresses the true concept of international cooperation in combating drug problem. I would like to thank CND and the Secretariat of UNODC for all their successful efforts in preparing and organizing this thematic discussion. Distinguished delegates, in light of the positive interaction with Pledge for Action initiative that was launched during the high-level segment of the 67th session, the Egyptian Ministry of Interior fulfilled its pledge to establish the Egyptian International Drug Control Training Center at the new headquarters of Anti-Narcotics General Administration and announced its opening during the 68th session of CND in March 2025, which aims to train drug law enforcement cadres in different countries. This center consists of 8 halls with various sizes, with a total capacity of 350 trainees. These halls are used to organize different activities, training courses, workshops, and conferences. They are equipped with modern screens, audio systems, interpretation devices, and internet services. The center further include a lounge equipped to host and hold meetings involving high-profile figures and senior officials from international drug control agencies. The center also include a library, chemical laboratory, gym, electronic testing room, health club, medical clinic, cafeteria, and restaurant. The training programs covers various fields, including methods for combating illicit drug cultivations and synthetic drugs, mechanisms for combating money laundering crimes resulting from drug trafficking, surveillance methods, investigation techniques, information gathering, and source recruitment. The Egyptian Ministry of Interior welcomes support for the efforts of anti-narcotics agencies in the field of training and exchange of expertise by designing training courses for various countries according to their needs and requests. Ladies and gentlemen, finally, I would like to thank CND and UNODC for their role to coordinate international efforts for combating drug illicit trafficking, and also sincerely invite you to strengthen cooperation to protect our societies from the dangers of drug problem. Thank you, sir.
I thank the representative of Egypt for that report on implementation. And I intend to now close this meeting in the interest of time for now, and we will resume our discussions at 3 p.m. Before I leave the room, I'd like to invite Mr. Malouf to maybe formally thank our panelists. And maybe.
Thank you very much, Mr. Chair, and thank, first of all, the CND and through you as well for having a session on prevention. And yes, I would like to formally thank the generosity of the time and expertise that is shared by the entire panel with regard to this discussion, and share everyone's point of view. And hopefully, if the time allows, we will provide you with the summary in terms of everything that was discussed. But thank you very much for that. And thank you.
And for those listed to speak, we will try and take that up at the next session, probably at the beginning or at the end, depending on how we can manage time best. So I thank you all, and I look forward to seeing you at 3 p.m. Thank you.
Distinguished delegates, I just maybe want to remind, it was already said before, that there will be an event on synthetic drugs organized by the government of Canada in room CR3 starting at 1:30. Thank you.
لا هو من الكنترول عندي. من الكنترول من الكنترول.
Guys, I'm very sorry, but I don't have no stick, but I didn't prepare to get the gift, but if you can see me, from that I cannot see you, but I'm not going to just I think we need to work closer.
Chintore one last. Ore. Takuvanonotsa. Zvaishandisa. Manje munobuda nevekunyika kwenyu. Ndozoda kune bheki. Yes, Tamiru wana PS.
Δεν φαίνομαι, πρέπει να σκύψω πολύ. Στο Ζιμπάμπουε. Θα βάλουμε τον Greece. Δεν είναι ωραίο. Με Λινέλα να βγάλουμε. Και δεν θα έχουμε. Πρέπει να χτίσει εδώ. Και να κάνεις παρέμβαση.
Να κάνουμε και έτσι.
Να κάνουμε
να πουλήσω μόρι στα παιδιά.
Ναι.
Μα
ποιος το πληρώνει αυτά εκεί.
Ωραία. Όχι, κάτσε να τα βάζουμε κάτι, ρε παιδί μου, μισό λεπτό.
Θα τα ξέρουμε απ' έξω.
Ναι. Πάρε λίγο. Τι πήρε τον άνθρωπο. Πάρε λίγο.
Oh, it's on. How we close?
What's the plan for this morning session? To continue? Yeah, with this one. Yeah. But you know, when we come to Vienna, we always have no family, no other obsessions. Just focus on stuck here and with the money discussion. But the weather is so lovely, we should catch some sun at least in the Rotunde. Great. Good job. Setting such a level. Okay. just send me on WhatsApp the room number, just to be sure that I have the, because otherwise I would not find it. Yes, please. Thank you.
Ja, also das ist in den letzten paar Jahren immer schon okay, also das manche kommen dann halt noch, aber nein. Und da vorne die Zuchtfall, also genau, also du kannst auch alle finden, einfach auf jeden Fall. Ja, heute kommt das alle online. Okay. Am Nachmittag werden wir deswegen habe ich ja, hier zum Beispiel ja, zu schreiben. Ja, aber machen wir doch nicht nur zwei Filter. Ja, ja. Okay. Aber jetzt ja, und eine Bewegung von auch überwiegend, also nichts für den Umsatz ohne einen sehr strengen Überlegungsprozess und Fragebögen, Starter, Datencollection und sonstiges, ja, also schon ein bisschen schlechter. Aber ich habe sure that with the land revenue si è fatto tanto sport.
Thank you.
Ναι, γιατί την εξέχασα. Γιατί μου απάντησε εμένα προσωπικά και δεν θα το ξαναστείλετε. Απάντησε σε όλους και μου φαίνεται και όλοι τι κάνουν. Σωστά. Ας τώρα το έχω πάρει γιατί αυτοί εδώ οι μαλάκες έχουν την παλιά λίστα των εθνικών συντονιστών.
Ακόμα. 100 φορές την έχουν στείλει.
Όχι, για την Κοπενχάγη. Και έχει κουντζίδες και παπνίστες άλλους.
Αφού όλα τα έχουν στείλει.
Την Πολωνική Προεδρία. Το Ζαβό. Θυμάσαι. Ένα Ζαβό.
Θα κάψω για τις φυλακές.
you.